everyone. Very good evening to all of you. So, after a long time, I'm live today and I'm super excited for the session as you. So, today we are going to dissect immunology up to its fibers. So, it's a very important topic, and I must say, it's a very emerging topic. And every day, many new discoveries are getting unfold in immunology. And it's a complicated topic, but I will make a cakewalk for you. Now, this topic is important in two subjects, in pathology as well as microbiology. So, we will complete entire immunology in one shot. So, that is the target today. And it's a very important topic for whatever competitive exam, the medical entrance exam you are targeting. Whether you are going to write your prof exam, whether you are going to write your competitive exam like NEET PG, FMGE, INICT, USMLE, PLAB, whatever you are targeting, this topic is ultra important. So without wasting any further time, I must start. Can I start? Can we start? So let me start the complete immunology in one shot. Let me share my screen with you. So here is the complete immunology in one shot. So this is the agenda. This is the overview. Today, first of all, I will discuss a little bit about the general immunology. I will let you know the two types of the immunity, the mechanisms, overall overview. Then we will start hypersensitivity reaction. I will be discussing 5 types of hypersensitivity reaction with their mechanisms, with their examples, with their pathogenesis, each and everything. Then we will jump on the transplant rejection, the mechanisms, direct, indirect, everything. Then we will come on autoimmunity. This topic is in high demand. Many students requested me to include this topic in today's session. So I have included that. Then we will come on immunodeficiency disorder. Many students requested me to take this also. And in the last, the ultra important, super important, last but not least, amyloidosis. So this is the agenda. We will try to cover all these topics in detail. So let me start without wasting any time. Can we go? Can we run? Can we start the marathon? Huh? Are you ready? So let's start it. Let's start with general immunology. A little bit about the overview about the immunity. The people who don't have any idea what is immunity. So what is immunity? I always say immunity is like army in human body. So we all have army in the country. So what happens whenever a terrorist try to enter the country's territory? What happens? The army get activated. In the army, who are there? In the army, we have the soldiers. The soldiers get activated, and there is a fight between the terrorist and the soldier. And let's see who is winning. If the soldier is winning, that is our immunity. And if the terrorist is winning, that is infection. Who's the terrorist here? The terrorist can be bacteria, can be virus, can be fungus, can be parasite. It can be any infectious organism who causes the harmful effect on human body. So we can compare it with the terrorist. Terrorist is the person who cause harm to the country people. In the same way, these are the organisms which cause harm to the human body. That's why we can call them terrorists. So who is the army in human body that protect us from the terrorist, from the infectious organism? The army in human body is our immunity. So who are the soldiers in our army? There are 2 types of soldiers that God has provided: B lymphocyte and T lymphocyte. The 2 soldiers, the 2 grade of the soldiers we are having. So whenever B lymphocytes are involved, it's humoral immunity. And whenever T lymphocytes are involved, it's cell-mediated immunity. So both of them are immunity. Both of them are immunity, but like the army, but the soldiers are different. The soldiers who are involved, they are different. We have 2 types of soldiers. So let me first tell you the mechanism of the cell-mediated and humoral immunity before starting the topic immunity. You must understand the 2 types of immunity. Then only you can understand the various diseases like autoimmunity, hypersensitivity, immunodeficiency. Otherwise, you can't understand anything. If you know the normal, then you will be able to understand the abnormal. I cannot directly jump on the abnormal, right? So let me tell you the 2 types of immunity. So let's start with the antigen. Who is the antigen? Antigen is anything who is foreign for human body, apart from self. So we have self tissue, and anything foreign enters in human body, we call it antigen. Antigen is a foreign particle. Okay, it can be bacteria, virus, fungus, or parasite. Better to call this antigen as terrorist. Better to call it a terrorist. Okay, so this is a terrorist. As soon as a terrorist enters in my body, like antigen enters in my body, 2 things can happen. One of the 2 immunity, or both the immunity can activate it simultaneously. We will discuss one by one. So there is a possibility that this antigen go and stimulate the B lymphocyte, one of the soldier. I told you there are 2 types of soldiers, the B lymphocyte and the T lymphocyte. Now imagine if the B lymphocyte get activated, one of the soldier get activated. What does they do? The B lymphocyte convert into plasma cells. and the plasma cells form antibodies. There are 5 types of antibodies in human body: IgG, IgA, IgM, IgD, IgE, gamma. We call them gamma in short. GAMDE, gamma, IgG, IgA, IgM, IgD, IgE, they are formed. What does they do? They will react with the antigen. Antigen antibody complexes are formed and a macrophage will come and engulf all of them. Okay, opsonization is the end result. So antigen is destroyed. In this way, the B lymphocytes are destroying the terrorist, destroying the antigen. The end product here is antibody. With the help of the antibody, the destruction is taking place. And this immunity is known as humoral immunity. So in humoral immunity, there is the big role of B lymphocyte, one of the great soldiers we are having in our body. Okay, now there is a second possibility that instead of activating B lymphocyte, this antigen is going to antigen presenting cell. Where it is going? It is going to antigen presenting cell, APC. APC is antigen presenting cell. Antigen presenting cell is a cell that engulfs the antigen. First of all, it will engulf the antigen. Then it will degrade it into multiple small pieces. Okay. After degrading and processing, it will present it on its surface. It will present it on its surface. Can you see on the surface of the antigen presenting cell, this green color structure? This is major histocompatibility complex, MHC. So on the MHC, it is presenting the antigen. To whom it is presenting? That's why it is known as antigen presenting cell. What does it do? It eats antigen, degrade it into multiple small pieces, and then present it on its surface. Present it to the next cell. Present it to the next cell. Who's the next cell? The big soldier, the great soldier, the second soldier. The second type of soldier, that is T lymphocyte. I told you, in human body, we are having 2 types of soldier. B lymphocyte have a role in humoral immunity. T lymphocyte have a role in cell-mediated immunity. So antigen presenting cell will give a signal to the T lymphocyte, CD4 T lymphocyte, that this antigen have entered in our body. On receiving the signal, T cell get activated. And on activation, it secretes many cytokines from it. Many type of cytokines, interleukins from that. Now, these cytokines will cause the inflammation, and with the help of inflammation, the antigen will be destroyed. So, this immunity is known as cell-mediated immunity. Here, antibodies are not formed. Here, the end product is cytokine. So, have a look on the end product here. So, end product here is cytokine, and end product here is antibody. Here, B lymphocytes are involved. Here, T lymphocytes are involved. So that is broadly the 2 type of immunity. Details I will provide. This is the broad discussion. The students who don't know what is the 2 type of immunity, if you have any confusion, anyone have any doubt till now, you can write on in the chat box. So you got the 2 types of immunity. So I taught you there are 2 types of immunity, the cell-mediated and the humoral, and we have seen the mechanism of each of them. The summary is that we have learned in the 2 type of immunity, the 2 types of soldiers are involved. Immunity is army. In the army, we have the soldiers. So in humoral immunity, the B lymphocytes are involved and antibodies are the end products which is causing the destruction of the antigen. And in cell-mediated immunity, T lymphocytes are involved. And here the end product is the cytokine which is causing the destruction of the antigen. Till now, we have learned this. So this is the mechanism. You got it? Dr. Tyagi, I have repeated the mechanism. You got it? So just learn which type of lymphocytes are involved in which type of immunity. Okay. So here in cell-mediated immunity, the antigen is engulfed by the antigen presenting cell. Antigen presenting cell will degrade it, process it into multiple pieces and present on the surface. It will present to the next cell. The next cell is the T lymphocyte. T lymphocyte get activated on receiving the signal and it secretes the cytokines. Cytokines will cause the inflammation and destroy the antigen. So the end product here is the cytokine. So this is the mechanism I have repeated, right? Now let me start the main topic here, hypersensitivity reaction. How many of you are ready? Can I start hypersensitivity reaction? Can I start? So let's start hypersensitivity reaction. Let me ask you a question. We all have army in our country, okay? In the army, we all have the soldiers. My question to you, soldiers are good or bad? Soldiers are good or they are bad? Of course, the straightforward answer, ma'am, they are good because they protect us from the terrorist, from the foreign particle, the people who harm us. They are protectors. So that's why they are very good. We respect them. They are good. Okay. So in human body, the soldiers are the lymphocyte. Now, but you imagine a soldier. You do an imagination of a soldier who is hyperexcited. The soldier is hyperexcited. First time he got the weapon in his hand. He is hyperexcited. So he is supposed to kill only terrorists. But since the soldier is hyper-excited, apart from killing the terrorist, it is killing the terrorist. It is killing the terrorist. But apart from killing the terrorist, it is killing the country people also. oh my God, is he a good soldier? No, he's a mad soldier. Kill that soldier. So he's a hyper excited soldier. It's not a good soldier. It's a very bad soldier. This is known as hypersensitivity mad topic. So what is hypersensitivity? You tell me. What is hypersensitivity? So let me define. Hypersensitivity is hyper excited, exaggerated state of the normal immune system. So here the soldiers are hyper excited. So they kill the terrorist, but apart from killing the terrorist, they cause harm to the country people also. I'm telling you the difference, Veer Chaudhary. I'm telling you the difference. Listen. Autoimmunity will also come after this. Okay. It is not autoimmunity. Now imagine two types of soldiers. There is a soldier who is killing the terrorist along with the country people. He's a mad soldier. There is another soldier who is killing only country people, not even terrorist, only country people. So this is hyper excited soldier, है ना? And this is known as hypersensitivity. And this is known as autoimmunity. In autoimmunity, body's own immunity is targeting the own tissue. That is autoimmunity. That is my next topic. Currently, I'm not teaching you autoimmunity. I'm telling you the difference. Please understand the difference between hypersensitivity and autoimmunity. In hypersensitivity, the immunity is normal immune system get exaggerated. So it is exaggerated. It is killing the foreign particle, but it is killing the host body also. So that is the definition. How many of you got it? So this is hypersensitivity. Can you define it? Can you define it for me? Yes, hypersensitivity is the exaggerated state of a normal immune system. In other words, you can call hyper-excited soldier a mad soldier. So apart from killing the terrorist, it is killing the country people also. So mainly it is damaging the antigen, but it is causing adverse effect on the host body also. This is hypersensitivity. So how many types of hypersensitivity are there? There are 5 types of hypersensitivity. Broadly, there are 4. Type 1, type 2, type 3 and type 4, but a stimulatory version of type 2 is type 5. So I will be explaining you all type 5 with their mechanisms and examples. How many of you are ready? Okay, autoimmunity will also come after this. So wait a while, let me finish this. After that I will come. Maybe for the next 2-3 hours, Pooja, the session will be live. Okay, so chalo. Let's come on type 1, 2, 3, 4, 5. All type of autoimmunity one by one. So type 1, 2, 3. 1, 2, 3, they involve humoral immunity. And the type 4 involves cell-mediated immunity. So I will come on this slide again. Let me explain you the mechanism. Let me start with type 1. Can I start with type 1? Everyone is ready? Give me a thumbs up. So let's start with type 1. The other name of type 1 is allergy. Do you have allergy with something? Different people have allergy with different thing. The allergen is different for everyone. Many people have allergy. Allergy is a very common disease. It's type 1 hypersensitivity. Whatever allergy you have with whatever thing, it's type 1 hypersensitivity. Allergy ke liye we require allergen. Allergen can be different. For example, some people have, for example, me, I'm having allergy with dust. So whenever I come in contact with the dust, I inhale the dust. I have sneezing and my face become red. I'm having lacrimation. I'm having a runny nose. So I'm having allergy with the dust. That is the respiratory system is involved. I'm having a respiratory allergy. Some people have allergy with some particular food item. For example, seafood. Very common. People eat the seafood, they have diarrhea. They have abdominal pain. So they have GIT allergy. Some people have allergy with such particular cosmetic. If they apply some particular soap or cosmetic, they have dermal allergy. So that is the dermal tissues involved. So different systems. So respiratory system, GIT system, skin, different systems can be involved. So allergen can be different for different people, but it is known as type 1 hypersensitivity. The mechanism is same. In all of them, the mechanism will be same. That is type 1 hypersensitivity. So let me tell you the mechanism. On this master slide, I have drawn the mechanism of all 4 hypersensitivity in one shot. So I will be explaining you 1, 2, 3, 4, one by one. In the end, we will compare them at a glance. Okay. So filhal, for now, let me tell you type 1. The mechanism of type 1 hypersensitivity, that is known as allergy. So let me start. Please see. So as soon as an allergen enters in my body, suppose I am the subject, and in me this allergen is entering. Let me call the allergen as antigen. Allergen, I'm having allergy with dust. So my allergen is antigen, that is dust. So if I'm inhaling the dust, so 5 cells will come one by one. 1, 2, 3, 4, 5. You have to learn the sequence. So the first cell which come in contact with the antigen is antigen presenting cell, APC. APC will come. Okay. APC will come. This APC will engulf the antigen. First of all, it will engulf the antigen. It will degrade the antigen into multiple pieces. And after degrading, it will present it on the surface to the next cell. Second number cell. Second number cell. So second number cell will be CD4 T lymphocyte. It is helper Th2. Please mind my words. It's helper Th2, not helper Th1. Because helper Th1 will also come in your options in MCQ. Helper Th1 will be involved in type 4 hypersensitivity, not in type 1. It's helper Th2. They will get activated. As soon as they receive the signal, here, they will get activated. These are helper Th2 cell. They will get activated. On activating, what does they do? They secrete cytokines from them. They secrete many cytokines, but the most important is interleukin 4. They secrete many cytokines, but the most important is interleukin 4. Okay, this interleukin 4 will go to the next cell, the third cell. 5 cells will come. This is the third cell. The third cell here is a B lymphocyte. It will activate B lymphocyte. This is B lymphocyte. Let me write. So first was APC, then helper Th2, then B lymphocyte. B lymphocyte get activated on receiving the signal from interleukin 4. Okay, on activating, B lymphocyte convert into fourth cell. The fourth cell coming here is the plasma cell. We all know B lymphocyte convert into plasma cell. So this is the plasma cell which is formed. So B lymphocyte convert into plasma cell. And finally, plasma cell will form the antibodies. What does the plasma cell do? They form the antibodies. So here the antibodies are formed. Which antibodies? I told you there are 5 types of antibodies. IgG, IgA, IgM, IgD, IgE. Here IgE type of antibodies are formed. And they will go to the fifth cell, the last cell, the fifth cell, the mast cell. This is a mast cell. And these antibodies will go and sit and join on the surface of the mast cell. They will remain on the surface of the mast cell by Fc fragment, and they will remain there forever. The episode is over. First time doesn't, no symptoms. So whenever, just suppose I'm having allergy with dust, as I told you. So whenever the first time dust particle enter in me, I don't have any symptom. Because the first time it is only sensitization. My mast cells are sensitized for the next event. But first time, no symptom. No symptom. Whenever I came in contact first time with dust in my life, I don't have any symptom. But this all events have taken place. See the 5 cells in a sequence, 1, 2, 3, 4, 5. But whenever the same antigen enters second time onwards, second time, third time, fourth time, any time, subsequent time, you can say, anytime, whenever the same antigen enters. So this APC will recognize you are the one who have entered previously also. Because the body have memory in the immunity. In the immunity, we have memory B cells. So these memory B cells, there are memory B cells. These memory B cells will recognize the antigen. You are the one for which we have already done all the homework. You directly go to your antibody. We will not repeat the process for you. You directly go to your antibody. So this is recognized by the memory B cells and it will be diverted towards its antibody directly second time onwards. So as soon as the second time dust enters in me, second time, not first time. First time this complete event takes place. Second time, it will directly go to its antibody which is present on the surface of the mast cell. As soon as it is bind with the antibody will give a signal to the mast cell that antigen have arrived. As soon as the mast cell will receive the signal, mast cell will burst. On the surface of the mast cell, calcium channels are there. Calcium channels will open, calcium influx will take place and mast cell will burst. This is causing the bursting of the mast cell because of influxing of the calcium. Mast cell will burst. As soon as the mast cell will do the lysis or bursting, the granules will come out. This step is known as degranulation of mast cell. What it is known as? Degranulation, the last step. Degranulation of mast cell. Degranulation of mast cell. Okay, now the granules contain many important things, 5 important things: histamine, serotonin, prostaglandin, leukotriene, and platelet activating factor. And this causes allergy. This causes the symptoms of allergy. What we have in allergy? We have glandular secretion like lacrimal secretion, nasal secretion. So they increase the glandular secretion. They cause vasodilation. So face become red. They causes increased vascular permeability. So there will be edema everywhere. So all these things, the symptoms of the allergy is due to these granules. So the episode is over. Now every time when the dust will happen, or any allergen, the particular allergen will enter, the same thing will happen. It will be directly diverted to its antibody. How many of you got it? Learn the 5 cells in a sequence on which you get many MCQs. People, focus on the MCQs. Listen, the first cell is APC. Then the second cell is helper Th2. The third cell is B lymphocyte. The fourth cell is the plasma cell. And the fifth cell is the mast cell. Which antibodies are formed? IgE antibodies. What is the cytokine responsible for activation of B lymphocyte? It's interleukin 4. These all are your MCQs. So please learn it. You get many questions here. Okay. Say yes. I will show you the MCQs also. So the same thing is shown to you here also. Have a look, everyone on the screen. Focus on type 1. Have a look. Just summary is given. So this is the allergen. Have a look. It is going to APC. APC is engulfing and degrading. Going to the helper TH2. Helper TH2 secreting interleukin 4. Interleukin 4 activating B lymphocyte. B lymphocyte converted into plasma cell. Plasma cell form IgE antibody. IgE antibody go on the mast cell and sit on the surface of the mast cell forever, forever, forever. Now, if the same antigen enters again, it directly go to the mast cell. It will bind on the surface of the mast cell. Mast cell will burst. The granules will come out and this will cause allergy. So what is the end result? The end result is allergy. Mast cell will burst now. Mast cell will burst because on the surface of the mast cell, calcium channels are present. So as soon as the antigen will bind, it will give signal to the antibody will give signal to the mast cell. The calcium channels will open. Calcium influx will take place and that will cause bursting of the mast cell. Got it? Medical lectures by MM sir. Got it? Can we go ahead? So this is type 1. Hana, in your exam, if you're targeting any prof exam, don't write paragraph, write the flowchart. Flowchart. So quickly we will visit the flowchart. Quickly, everyone. Antigen, first time entering, first time. It is captured by APC. Okay, APC will give the signal to helper TH2. Helper TH2 secrete many cytokines, but most important is interleukin 4. Interleukin 4 activate B lymphocyte. B lymphocyte convert plasma cell. Plasma cell form IgE antibody. IgE antibodies sit on the surface of the mast cell, remain there forever. This is sensitization. Now, this is sensitization. Now, the same antigen enters second time. It will directly go to its antibody. Antibody will give the signal to the mast cell. Mast cell will rupture. The granules will come out. Granules contain all these things and that will lead to allergy. Got it? So rather than showing you a diagram, I will show you a video. Ready, people? Anna, ready? So see, these are the antibodies. Have a look. IgE antibodies. Have a look. See again. These are IgE antibodies. Okay, IgE antibodies are formed from the plasma cell. They are going, this yellow color cell is mast cell. Have a look the labeling. They are sitting on the surface of the mast cell. Now the antigen comes second time. It is binding on the surface of the antibody. It will give signal to the mast cell. It will give signal to the mast cell. Mast cell rupture. The granules come out. This is known as degranulation of the mast cell. Anyone have any confusion? Can we go ahead? So this is degranulation. I hope you got it. Now, as I told you, allergy. I'm teaching you type 1 hypersensitivity. The other name of type 1 hypersensitivity is allergy. Allergy is the other name of type 1 hypersensitivity, as I told you, right? Now, allergy can be localized. As I told you, some people have respiratory allergy. For example, I'm having allergy with dust. So I'm having respiratory allergy. One system is involved. I inhale dust. I have sneezing, cough. So respiratory system is involved. Some have GIT allergy. When they eat, they have diarrhea, some particular food. Some have dermal allergy. So one system is involved at a time. It is localized allergy. Localized allergy is known as atopy. Atopy. Okay, one particular system is involved. But sometimes the allergy is systemic. Complete body go in allergy. The severe form of allergy. Very severe. People die. This is known as anaphylaxis. Anaphylaxis is the most severe form of allergy. It's an emergency. Only life-saving drug here is the adrenaline. You should learn the doses and the route. How adrenaline should be administered in anaphylaxis. You should be prepared. You all are healthcare providers. You never know which person is having allergy with what thing. You may be thinking that I am a radiologist. Mera kya lena dena allergy se? I will not treat the patient. I will just diagnose them. Suppose you are a radiologist and without you are giving a contrast for CT or MRI. Before giving the contrast, we always do the testing. Before testing, you are directly injecting the contrast. Someone is injecting, for example, and the person is having allergy with the contrast. What will happen? Within few seconds, the person will have anaphylaxis and the person can die on the spot. So adrenaline should be always handy and you should know how to administer it. Got it? Got it? So this is allergy. So allergy. What are the two types of allergy? Localized is known as atopy and systemic is known as anaphylaxis. Okay, so localized is known as atopy and systemic is known as anaphylaxis. The two types of allergy. Now, what are the examples of type 1? We are done with type 1. What are the examples of type 1? Okay, Legend Insider. I will take a less session on that, but don't just copy the same text and message and put it again and again. Definitely, I will do the session on RNA viruses. Okay, listen now. So what are the examples of type 1 hypersensitivity? There are many. Whatever allergies you know. How many allergies you know? Say. How many allergies you know? Do you know eczema is allergy? Of course, everyone knows. Hay fever is the allergy. Asthma is allergy. Urticaria, anaphylactic shock, and dermatitis. These are the allergies. Don't learn them because you already know them. They are allergy. What you don't know, learn that. Do you know Putzner reaction is type 1 hypersensitivity? PK, Putzner reaction. Do you know Cassoni test is type 1? Do you know Theobald-Smith phenomenon is type 1? Do you know Schultz-Dale phenomenon is type 1? You don't know this. So learn this, make a mnemonic on this, what you don't know. Don't overstress your mind. Hana, if you know anything, don't try to mug it up. If you don't know anything, make a mnemonic and mug up. So here, the 4 reaction I want you to learn, on which frequently MCQs come in your exam. Cassoni test is an example of type 1, PK reaction, Theobald-Smith, Schultz-Dale, these all are examples of type 1 hypersensitivity. So the mnemonic is proximal convoluted tubules, PCTS. P stand for Putzner, C stand for Cassoni, T stand for Theobald, and S stand for Schultz-Dale phenomenon. Okay, G, got it. Give me a thumbs up. Can we go ahead? So we are done with type 1. That is allergy. Let me come on type 2. Type 2 is known as cytotoxic reaction. Type 2 hypersensitivity. Okay, type 2 hypersensitivity is cytotoxic reaction. Now, by the way, I will take 2 and 3 together. I will take 2 and 3 together. Just see the mechanism of both of them. Have a look on 2, type 2 here, and have a look, or rather I will draw. Then I will show you here. Listen, type 2 and type 3, I will show you. I will draw it for you. So what is the difference in type 2 and type 3? Here I am drawing type 2. And here I am drawing type 3. Back to back, parallel, because they are same. Only the last step is different. So please understand them back to back. So here the antigen is not free. The antigen is present on the surface of a target cell. The target cell is a human cell. And here the antigen is a free soluble antigen. So please see the difference in antigen. Please see the difference in allergic conjunctivitis is of course allergy. Hrithik, naam mein hi hai usme to allergic. So of course it is allergy. Now it is an example. Okay, all the allergies will come there. ठीक है जी? चलो. So in type 2, the allergen is present, not allergen, I'm sorry. The antigen is present on the surface of a target cell. Target cell is a human cell. It's not a free soluble antigen. It's a particulate antigen. Here the antigen is soluble. That is the difference. Both of them will go to B lymphocyte. Here also B lymphocyte. Here also B lymphocyte. In both of them, B lymphocyte convert into plasma cell. Here also plasma cell. And here also plasma cell. Okay, in both of them. Plasma cell get activated. B lymphocyte are there, activated, they convert into plasma cell form antibodies in both of them. So here also antibodies are formed. Here also antibodies are formed. So which antibodies are formed in type 1? I'm asking you, which antibodies are formed in type 1? IgE. Here Ig is not formed. No. Here IgG or IgM. Again I am writing IgG or IgM are formed. Okay, in both of them till now is same. Now these antibody will go and bind with its antigen. This antibody will go and bind it with antigen. Let me draw the antigen antibody complex. Let me draw it for you. So here I am drawing the antigen antibody complex. See, this is a target cell. On the surface of the target cell, this is the antigen and this is the antibody. Antigen antibody complex here. Now I'm drawing the antigen antibody complex there. So there simply soluble antigen is there. And the antibody is coming and binding here. Antigen antibody complexes are formed here also, here also. Here the antigen antibody, since antigen was already present on the surface of target cell. Okay, so antigen antibody complexes are on target cell. But here antigen antibody complexes are free. That's why these antigen antibody complexes will go and deposit over the tissue. This is human tissue. Human tissue. It can be any human tissue, any organ. It can be any organ. Now compare, till now everything is same. Compare. Only the antigen is different. Here the antigen is present on a target cell, and in type 3 the antigen is present. It's a free antigen, soluble antigen. Both of them B lymphocytes are activated. They convert into plasma cell. They form the antibody. Antigen antibody complexes are formed. Here complexes do not deposit. Here they deposit over the tissue. Now the last step is different. The last step is different. Listen. The last step is complement activation. Here also complement get activated. Here also complement is get activated. But here which complement? C3b will get activated. C3b. And here which complement get activated? C5a. C5a or C5 to C9, mainly C5a. Okay, complement is different. So here C3b will come and bind here. C3b. And here C5a will come and bind on the antibody. Listen, the role is different now. So end result will be different. Please understand, the end result will be different. What is C3b? Do you know macrophage? We all have macrophage in our blood. Do you have macrophage in your blood? Of course you have. We all have macrophages in our blood. What is their role responsibility? What does they do? Say, ma'am, macrophage eat the foreign particle. So yes, we know macrophage eat the foreign particles. Does the macrophage have eyes? They see this is self, I don't have to eat this. This is foreign, oh, let's eat this. Do the macrophage have eyes? How does macrophage recognize this is self and this is foreign? I don't have to eat this, I have to eat this. How does macrophage recognize? I'm asking you. Does anyone know the answer? Huh? Does anyone know the answer? The answer is C3b. C3b does the tagging. So wherever macrophage know only one rule. Macrophage know only one rule. Wherever there is a C3b, I have to eat it. Whatever its cell it is, I don't know. Whenever the cell have C3b, I have to eat that thing. Okay, so that is known as opsonization. Opsonization means tagging. So C3b is doing the opsonization. So here a macrophage will come. A macrophage will come and engulf everything. Engulf everything. So antigen is gone. I'm very happy. Antibody is gone. I'm double happy. Hana, complement is gone. Okay, no problem. But my cell is gone. Oh my God. My cell is gone. This was my body cell. So the end result is phagocytosis of my own cell. Phagocytosis of my own cell. What I'm teaching you, by the way, so ma'am, you are teaching us hypersensitivity. What is hypersensitivity? Mad soldier. Killing the terrorists, it's okay. But killing country people also. So my cell is gone. My cell is my country people. So it is gone. Antigen is gone. I'm happy. The terrorist is gone. But along with the terrorist, my people are also gone. So that is type 2 hypersensitivity. The end result is phagocytosis. How many of you got it? How many of you got it? Got it. Can we go ahead? Okay. So this is type 2. The end result is phagocytosis. In type 3, here, instead of C3b, we have C5a. We have C5a complement here. So what does C5a do? It don't do the opsonization. It don't do the tagging. It attracts neutrophil from the blood. So it is there on the tissue now. From the blood, neutrophils will be attracted and this tissue will contain many neutrophils. I mean the tissue get inflamed. My tissue get inflamed. It's my tissue, my own body tissue. So the end result is the inflammation. End result is inflammation. Antigen will be gone, it's okay. But my tissue is harmed. My tissue is suffered. So end result is inflammation. So that is hypersensitivity. So type 3. So see the end result of type 2 and type 3. In type 2, the end result is phagocytosis. And in type 3, the end result is inflammation. How many of you got it? Give me a thumbs up. How many of you didn't got it? Write your specific query. Don't say, ma'am, repeat it all. Write your specific query. On which step you have the query? Yes. Anyone? Give me a thumbs up either. Or write your query. Do one thing, people. React. Give a gesture. You got it. Give a note that you got it. Can we go ahead? Can I remove this page? Everyone. I'm waiting for your response. Yes? C3a is not involved. Ruhi. No. C3b or C5a. Okay. Function of C5a is to refer. The function of C5a is to attract the neutrophil. They are attracting the neutrophil inside the tissue. So tissue get inflamed. My body tissue get inflamed. So my country people are harmed. What is hypersensitivity? A mad soldier. Apart from killing the terrorist, it is killing the country people also. So in both these scenarios, here my target cell is gone and here my tissue got inflamed. So in both the scenario, the country people are harmed. I'm proving that these are hypersensitivity. I tried, got it. So this is type 2 and type 3. You can have a look. So see the antigen here, which is present on the surface of a target cell, say yes. And see the antigen here, which is a soluble antigen, say yes. Compare. Both of them are activating B cell. Both of them convert into plasma cell. The B cell convert into plasma cell in both of them. In both of them, the antibodies are formed. Here also, here also. Which antibody? Is it IgE? No way. It's IgG or IgM. Here also antigen antibody complexes are formed. Here also antigen antibody complexes are formed, which are deposited over tissue. Because the antigen was soluble, it was free. Here C3b is involved. Here mainly C5a. You can say C5 to C9, but mainly C5a is involved. So here end result is phagocytosis. And here the end result is inflammation. And in type 1, if you remember, the end result was allergy. So please, again I say, what is hypersensitivity? Again, I'm proving my point. Hypersensitivity is a mad soldier. Who is a mad soldier? Killing the terrorist. It's a good job, but killing the country people also. Hyperexcited soldier. Hana? So here, my body got allergy. Allergen is gone, theek hai, but my body got the allergy. Here, allergen is gone, theek hai, but my cell got phagocytosis. Here, allergen is gone, theek hai. Antigen is gone, theek hai, but my tissue got inflammation. So country people are harmed. And these are the 3 types of allergy having 3 different presentation, 3 different end results. Got it? So that is type 2, type 3 we have covered back to back. Now we will see the details. So type 2, I have already shown you the flow charts, I guess. No need to read it. I guess you got it. Type 2. Antigen present on the surface of a target cell. It activates B lymphocyte. They convert into plasma cell. Plasma cell form the IgG or IgM antibody. Antigen antibody complex is formed. It stimulates complement. Which complement? C3b. C3b do the opsonization, and the end result is phagocytosis. I will show you a video. See here. These antibodies are IgG or IgM. See the blue color dot. This is my antigen, and yellow color is the target cell, my cell, target cell. So again see, the yellow cell is the target cell, my cell, on the surface of which this antigen is present. So the antibodies are formed and they are coming and they are reacting with the antigen. Now the complement will come. This is the complement get activated. Complement is attracting the phagocyte, and phagocyte is coming. Phagocyte will come and engulf everything. It will engulf antigen, antibody along with my cell. So end result is phagocytosis. Got it? Got it? PDF will be provided after the session. Okay. So coming on the examples of type 2. The examples of type 2 is, the mnemonic is my blood group is Rh positive. These are the examples of type 2. Okay. M stand for myasthenia gravis. B stand for blood transfusion reaction. G stand for two things, good pasture syndrome and Graves disease. I stand for immunogenic thrombocytopenic purpura, ITP. R stand for rheumatic fever. H stand for hyperacute graft rejection. And P for pemphigus vulgaris. You can learn pemphigus vulgaris. Okay. So these are the examples of type 2. Type 5 is a special version of type 2 in which the end result, now compare type 2 and 5. Type 5 is a special version of type 2 only. Only last step is different. See. In both of them, the antigen is present on the surface of a target cell. Appreciate the target cell. Appreciate the target cell. Have a look. The antigen is present on the surface of target cell. It is activating B lymphocyte. B lymphocyte convert into plasma cell. Plasma cell is forming the antibody, IgG or IgM. Antigen antibody complexes are formed. Okay. Here complement get activated. Here complement is not activated. Here complement C3b get activated, the end result is phagocytosis. What is the end result here in type 2? The end result is phagocytosis. Here, when the antibody react with the antigen present on the target cell gets stimulated. Complement is not activated. The target cell gets stimulated. So end result is not destruction, it's stimulation. Here the end result was destruction, the destruction of my cell, my target cell, my own cell, my target cell. Here the end result is the stimulation of my cell. So type 5 is a special version of type 2 in which instead of destruction of the cell, there is stimulation of the cell. At least I tried. Okay, at least I tried. Got it? Say yes, say no, respond, say something. Got it? So that is the thing. So the end result here in type 2 is phagocytosis. In type 5, it's the stimulation. Rest of the steps are same. So out of all the examples I have told you for type 2, only 2 of them are type 5. You can say only 2 of them are type 5. Which 2? MG, myasthenia gravis and Graves disease. You can learn Mahatma Gandhi or you can learn some other mnemonic, MG. So MG, myasthenia gravis and Graves disease. These 2 are type 5 actually. They are special version of type 2, that is type 5. Anyone have any confusion in this topic? Anyone have any confusion? What happened after stimulation? The cell gets stimulated. So whatever is the function of that cell, it is doing more. For example, in Graves disease, this cell is the thyroid cell. It will get stimulated. It will secrete T3 and T4 and the person have hyperthyroidism. Okay, in this way. So whatever is the function of that cell, that will be exaggerated. So that is the thing. Got it? Anyone have any confusion? Can I proceed? People, can I proceed? So let me come on the type 3. I've already explained you type 3. We have already seen this type 3 with parallel to type 2. Here also you can see the same. So there is a soluble antigen. It's soluble antigen activating B lymphocyte convert into plasma cell form antibody. Antibody will come and form the complex with the antigen. Antigen-antibody complex deposit over the tissue. They activate complement C5a. It will attract the neutrophils and result is inflammation. So this is the flow chart. I will show you a video. See, this is a blood vessel. The lumen of the blood vessel contain antigen-antibody complexes. You can see antigen-antibody complexes are present. This antigen-antibody complexes come out of the blood and get deposited over the tissue. The yellow is the tissue. The complement get activated. C5a. It will attract the neutrophils. The neutrophils get attracted and the tissue have inflammation. The end result is the inflammation. How many of you got it? People respond. Can we go ahead? The end result is the inflammation. Okay. What are the examples of type 3? The examples of type 3 is SHARP. SHARP. In the end, we will revise a comparative pathogenesis and comparative example. First, you understand separately. So the mnemonic is the SHARP, in which we have triple S and we have double P. What is triple S? What is triple S? What are the 3 S? 1 S is serum sickness. One is Sheik test, one is SLE. All three are PYQ, your MCQs, please learn. H is HS purpura. A is arthrus reaction. R is reactive arthritis, and the 2P, polyarthritis nodosa. What is polyarthritis nodosa? It is a medium vessel vasculitis. And one is PSGN, post-streptococcal glomerulonephritis. One of the type of glomerulonephritis. We will revise, don't worry. Let me finish the last type 4. Type 4 is also known as T-cell mediated or delayed hypersensitivity. Let me tell you the pathogenesis. Listen, here is an antigen. Here there is an antigen. The antigen here is a non-degradable antigen. That is the peculiarity. What do you mean by non-degradable antigen? We cannot degrade, the antigen presenting cell cannot degrade it. For example, Mycobacterium tuberculosis, Mycobacterium leprae, these all are non-degradable antigen. So as soon as, imagine I am the subject and this antigen enters in my body. So the first cell is again same, antigen presenting cell, APC. APC will engulf it as usual, like type 1 only. It will try to degrade it but unable to degrade it, fail to degrade it, in contrast to type 1. In type 1, it was able to degrade it, but here it is unable to degrade it. So it will get afraid. What should I do now? I'm unable to degrade it. So it will take to the next cell. Who's the next cell here? It's helper TH1, not helper TH2. It will activate helper TH1. There is an antigen in our body. I'm unable to degrade it. What to do? Now what should I do? So helper TH1 will say, it's okay, don't panic, I will do something. You don't panic, you are unable to degrade it, don't worry. I will secrete 3 cytokines from my body, from me. So it will secrete 3 cytokines. What are the 3 cytokines? It will secrete interferon gamma, interleukin, and TNF. It will secrete 3 cytokines. What does these 3 cytokines will do now? They will take one cell out of the blood. They will take one cell out of the blood and they will make a granuloma. Here the end result will be a granuloma formation. Okay, so let me tell you the role. So let me talk about first interferon gamma. Interferon gamma take monocytes out. These are monocytes present in our blood. They will take the monocytes out. Once the monocytes are out, they are not known as monocyte. They are known as macrophages. So basically they are taking the macrophages out. Not only they are taking the macrophages out, they are increasing the size of the macrophages. So macrophages become increased size and they are known as modified macrophages. The modified macrophages are known as epithelioid cells. Multiple epithelioid cells fuses with each other and they form the giant cells. So 3 things are happening. Number 1, monocytes are coming out. They are macrophages. Macrophages increase in size. The modification occurs. It is known as epithelioid cells, and multiple epithelioid cells fuses with each other and the giant cells are formed. So this all is done by interferon gamma. Okay, interferon gamma story is over. Now the second story is for interleukin. Interleukin takes T lymphocytes out from the blood and accumulate them, migrate them, proliferate them, migrate them. The T lymphocytes, all of them are T lymphocytes. That's it. And the third, TNF, they will take the fibroblast out. The fibroblast. So they will take the fibroblast out. They will cause the proliferation and migration of the fibroblast. So how many cells we have at the end? How many cells we have? We have 3 types of cells. Epithelioid cells and giant cells are considered one only. Okay, epithelioid and giant cell form the center of granuloma. The T lymphocyte form the middle zone of the granuloma. And the fibroblast will form the outermost zone of the granuloma. In this way, the end result is a granuloma. On the next page, I will draw a granuloma for you. Okay, so let me try to draw a granuloma. In the center, I am drawing the epithelioid cell with few giant cell. Giant cell are the fusion of epithelioid cell only. This is center. The middle zone is formed by T lymphocytes. These are T lymphocytes. And the outermost zone is the fibroblast. So these are fibroblast. Fibroblast will do the collagen synthesis and there is a fibrosis. This is granuloma, a typical granuloma. So central epithelioid cells and giant cells are due to interferon gamma. Okay. The T lymphocytes are due to interleukin and fibroblasts are due to TNF. The end result is a granuloma. Okay. Got it? So this is the 4 type of hypersensitivity. Here also you can see this is an antigen going to the APC. APC is engulfing it like type 1 only. Here also there is an antigen, but here it was degradable antigen. Okay, here it's non-degradable antigen. Here also it's going to APC. Here also it's going to APC. Here APC is able to degrade it. That's why APC presented to helper TH1. Here APC is unable to degrade it. That's why APC is presenting it to helper TH1. So in type 1 hypersensitivity, helper TH2 is involved. And in type 4 hypersensitivity, helper TH1 is involved. Helper TH1 secrete 3 cytokines. They will take one cell out of the blood and the end result is granuloma. I am done. People, I am done. Okay. Got it? Got it? Yes or no? You check in the examples. Doha, I will give you the examples. Okay. So can we go ahead? Till now, anyone have any confusion? Till now, anyone have any confusion? Can we go ahead? Yes. So let's go ahead. Let's go ahead. Okay, I will cover all these topics. Many students are writing many topics in between. I will cover all of them. I'm having an eye on the chat box. But currently, do you have confusion in this topic? Let me know that. So that is type 4. Type 4 hypersensitivity. What are the examples of type 4? The example is John gave tulip popcorn to whom? Hashi. So John stand for John motor reaction. Tuberculin. Lipramin. Tulip, tuberculin and lipramin. Pop, pernicious anemia. Corn, contact dermatitis. And Hashi is Hashimoto thyroiditis. So these are the 4 types of hypersensitivity reactions in front of you. Does anyone have any doubt or any confusion in the mechanism? People kindly respond so I can move on the next topic quickly. So I do not want to teach you only hypersensitivity. I want to teach you many topics in the entire immunology. Be fast. Anyone? Otherwise, respond that you got it. Can we proceed? So have a look on the mechanism of the 4 types of hypersensitivity. Let me highlight one very important point here. The most important point here is that you can see in type 1 hypersensitivity, IgE antibodies are formed. Because B lymphocytes are there. Whenever B lymphocytes are there, antibody will be formed. In type 2, again B lymphocytes are involved and IgG or IgM is formed. In type 3 also B lymphocytes are involved and IgM or IgG are formed. So 1, 2, 3 are examples of humoral immunity where antibodies are formed. But in type 4, no antibodies are formed. B lymphocyte is not involved. Only T lymphocyte is involved. B is not involved. No antibody. So type 4 is an example of cell-mediated immunity. So please learn it. Please learn it. Got it? Can we go ahead? Can we go ahead? In type 2, will there be hemolysis, ma'am, as complement is present? Yes, Raju, hemolysis can be there. The phagocytosis can be there. The end result is phagocytosis there. Okay. So that is the thing. So these are the 4 types of hypersensitivity. So as I told you, in type 1, 2 and 3, the antibodies are formed. So these 3 are humoral. But in type 4, it's cell-mediated. No antibodies are formed. Type 1, 2, 3 occurs within few minutes to hours. They are immediate type. But type 4 occur after 24 hours. So it is delayed type. So these 3 are immediate. This one is delayed. These 3 are humoral. And the type 4 is cell-mediated. So please learn. We are done. And these are the examples of type 1, 2, 3, 4. Rather than reading them passively, why don't we write it? Can you tell me the examples of type 1, 2, modified version of 2, that is type 5, type 3, and type 4. Can you tell me the examples? Quickly, people, quickly. Start writing. So type 1, what are the examples? Say, ma'am, all the allergies we know. Whatever allergies you know. Along with that, P, C, T, S. Type 2, my blood group is RH positive. That is type 2. Type 5, from this only, MG, Mahatma Gandhi. That is type 5. That is myasthenia gravis and Graves' disease. Okay. Type 3, sharp, SHARP. It's triple S and it's double P. And type 4, the examples are John gave tulip popcorn to Hashi. Please learn the full form. Don't learn the mnemonic. Learn the full form. Please learn the full form. Got it? So we are done with hypersensitivity. Now we will solve some MCQs. I want each and every one of you to answer. Let's see who have learned. Let's see. It's your analysis now. So the first question is in front of you. Read the question. The question is tricky. Don't jump, people. Don't jump. Read it and tell me the answer quickly in the chat box whether the answer is A, B, C, D. Write down. So I'm asking you a question, which among the following 4 is a B cell-mediated hypersensitivity? Now there are 4 types of hypersensitivity, 1, 2, 3, 4. 1, 2, 3 and 4. Among them, if you know the mechanism, first 3 involve the B lymphocyte and the last one involve the T lymphocyte. First 3 are humoral, the last one is the cell-mediated. So indirectly, I'm asking you which among the following is 1, 2, 3. Or indirectly, I'm asking you which of the following is not type 4. So it's an indirect way of asking which of the following is not type 4. Which are the following? So what are type 4? What are the examples of type 4? Just now I taught you. John gave tulip popcorn to Hashi. This was my mnemonic. So tuberculin test, it's coming in type 4. Contact dermatitis, It's coming in type 4. I told you type 4 is delayed type. It's also true, but Arthur's reaction is not coming here. Arthur's reaction, it's coming in sharp, S-H-A-R-P, sharp ka A is Arthur's. So Arthur's reaction is type 3. Since it is type 3, here B cells are involved. And these three are the examples of type 4. So here no B cell is involved, it's T cell which is involved. So in this way, the answer is A. How many of you got it? The question was tricky. Rather than asking you a simple question, which of the following is not an example of type 4, the question is little bit in a different language. Got it? The next question is in front of you. I guess very easy question and everyone can answer it. Can you tell me the answer, please, people? What's the answer here? Yes, what's the answer? So Putzner-Kutzner reaction is mediated by which type of antibody? IgE, IgG, IgM, IgA. Yes, of course. Putzner-Kutzner reaction is an example of type 1. The mnemonic was PCTS. So P for Putzner-Kutzner reaction, PK reaction. And we know in type 1, IgE antibodies are formed. That's why the answer is IgE antibody. I guess everyone got it. The next question in front of you. Stimulatory hypersensitivity is which type? It's a modification of which type? The stimulatory one. It's a modification of type 1, type 2, type 3 or type 4. What's the correct answer? Yes, what's the correct answer I'm asking? Yes, the correct answer is type 2. It's a modification of type 2 and this is known as type 5. Stimulatory version of type 2 is type 5. Absolutely right. The examples are myasthenia gravis and Graves' disease. The next question, erythroblastosis fetalis is an example of which type of hypersensitivity? Erythroblastosis fetalis. So where it was coming? Can anyone tell me the answer? Is it type 1, 2, 3, 4? What were the mnemonic of type 2? The mnemonic of type 2 was my blood group is Rh positive. So what was B here? B was blood transfusion reaction. And if you know, erythroblastosis fetalis can be compared with blood transfusion reaction. It is Rh incompatibility, not ABO incompatibility between the mother and the fetus. If the mother is Rh negative and the fetus is Rh positive. So it is equivalent to blood transfusion reaction. So I will go with type 2 and you all are right. Absolutely right. I'm very happy that you got it. Now match the column. Which of the following match the column is false? See the pairs. So Theobald-Smith phenomenon is an example of type 1. Is it true or false? Serum sickness is example of type 2. SLE is example of type 3. And transfusion reaction is example of type 2. Which of the following is false? Only one of them is false. Can you tell me which one? One of them is false. Yes, absolutely right. Serum sickness is not an example of type 2. Serum sickness comes in sharp, S-H-A-R-P. One of the S. It's an example of type 3. But yeah, Theobald-Smith phenomenon is coming on type 1, PCTS. It's T. SLE is coming in type 3. It is one of the S of sharp. And my blood group is Rh positive. The B is the blood group. It's an example of type 2. So it's right. I know. So only B is false. So coming on the, I guess, next question, last question. And then I will come on the next topic. Myasthenia gravis is which type of hypersensitivity? Myasthenia gravis is which type of hypersensitivity? 1, 2 or 3, 4? I guess very easy question. My blood group is Rh positive. And for myasthenia gravis, everyone is right, type 2. But let me include one more option. Option E, that is type 5. Now what you will say? Is it type 2 or type 5? So yes, absolutely right. If type 5 is given, go with that. If it is not given, go with 2. So I will prefer type 5 as an answer than type 2. If type 5 is given, I will go with that. If not given, then I will go with 2. Got it? Can we go ahead? Can we go ahead? So let's move to the next topic. Can I move to the next topic? So yes, definitely. The next topic is the transplant rejection. How many of you want me to take this topic? It's a very complicated topic, but within 10 minutes, I will finish and summarize this topic like a cakewalk. Can we start, everyone? Ready? Give me a thumbs up. Ready? So let's start the next topic, transplant. We have already covered general immunology. We have already covered hypersensitivity. Now we will do transplant, and after transplant, the most important two topics will come: autoimmunity and immunodeficiency. Don't dare to miss it. Okay, so stay tuned here only. Okay, don't go anywhere. Let me start with the transplant rejection. The next thing, transplant. In any transplant, in any organ transplant, in any graft transplant, there is a donor and there is a recipient. The recipient is the host. Donor is the person who is giving the graft, graft. Okay, and recipient is the person who is receiving it. Yes, so there is a donor, there is a recipient. Now with advancement, many type of transplants are possible, like the kidney transplant, liver transplant, skin transplant, cornea transplant, heart transplant, lung transplant. Many transplants are possible. There is a donor, there is a recipient. Now donor can be live, donor can be cadaveric. Okay, and there is a recipient. Got my point? So you can see The donor is giving the graft to the recipient. So we have one donor, we have one recipient, that's transplant. So what we will do, we will give an incision to the donor. After giving the incision, we will go inside, we will take a portion of the organ from the donor and implant it in the recipient. So that is the transplant. So say, ma'am, what is the problem then? The problem is the rejection. What do you mean by rejection? See, everyone here. The problem is the rejection. You say, ma'am, problem kya hai? What is the problem here? The problem is the rejection. See, for example, there is a person who is having bilateral renal failure. Both the kidneys are failed in this person, the recipient. And there is a donor available. Maybe a relative, maybe not a relative, but there is a donor available. We know people can survive on one kidney also. So out of the two kidney, one kidney, the donor wants to donate one of the kidney to the recipient. So what we will do, we will take the kidney from the donor, the graft from the donor, and implant it in the recipient. So in the recipient body, we are implanting the tissue, the organ, the graft. But for recipient, it is foreign. The recipient have the immune system, na? Immune system is what? It's army. In the army, we have two types of soldiers, B and T. Both will kill it because it is foreign. It is foreign. So as soon as you will implant, it will be rejected. This is known as rejection. Rejection by the own immunity. Rejection. We do not want rejection. So what should we do? What we are supposed to do? What we are supposed to do here? We do not want rejection, no? So what we are supposed to do here? What should we do here? So we should give the immunosuppressive therapy to this recipient before the surgery, during the surgery, and after the surgery throughout the life. Immunosuppressive, that will suppress the immune system. That will suppress. So it's the bi-jet sword. If you're suppressing the immune system throughout the life post-transplant, the person is at higher risk of susceptibility of the infection. If you don't give the immunosuppressive drug, the person will have rejection of the graft. If you give the immunosuppressive drug, their person will be high susceptibility of the infection. So post-transplant life, you have to make a balance. And it's very difficult to manage it. How many of you got it? The problem is the rejection. You got the problem. The problem is the rejection. Whenever you are implanting, taking the graft from the donor and implanting in the recipient body rejected. The immune system of the recipient body rejected. So tell me the classification. Classification of the transplant. How many types of transplant are there? Tell me the classification based on the donor. Based on the donor, how many types of transplant are there? Tell me the best donor. Who is the best donor in which there is no chance of rejection? If I take the organ from that donor, tissue from that donor, I will not have any rejection, 0% rejection. Who is that? Me, myself. Yes. So number one, self. Self. I am only donor, I am only recipient. Say, ma'am, how it is possible? You are only donor, you are only recipient. For example, I got burns over here. Okay. So what we can do? We can take the skin from the back or the thigh and implant it here. It's my own skin, my own tissue. So after implantation, my body will not reject it. It's not foreign. So we are just changing the site. So it's not foreign. Such a transplant is known as autologous transplant. Auto transplant, in which the donor is the same, the recipient is the same, 0% chance of rejection. 0% chance of rejection, no rejection at all. But it's not always possible. In case of plastic surgery, it's okay, but it's not always possible. Okay, so who's the next best donor? Next best donor. Again, I want 0% rejection. Such a donor, it's not me, someone else. But again, I want 0% rejection. Who's the next best donor? The next best donor is, yes, twin. Bisma, not sibling. Say identical twin. Identical twin. There are two types of twin, monozygous and dizygous. So we are talking about monozygous twin, monoamniotic, monochorionic, monozygous twin, identical twin. Identical twin are the two persons which is having same HLA. Okay. So if there are two twin, one of the twin have some organ requirement, some organ failure, and the other twin is ready to give. So other twin can be the donor. So we can take organ from one of the twin and implant it other identical twin. So there will be no rejection because they have 100% HLA match. So such a transplant is known as Xenograft or also known as Isograft. Again, 0% rejection. But how many of you have identical twin? Me, I don't have any identical twin. I have siblings, but I don't have identical twin. Okay, we will not consider non-identical twin here. We will consider only identical twin. We will consider only identical twin. Got it? So what if I require a graft in future? I don't have identical twin. So from where I will bring? So most of the population don't have the twin. So it can be any person from the same species, any human, same species. It can be a relative, it can be a known person, it can be an unknown person. If multiple donors are available, suppose I require a graft and multiple donors are available, we will do the HLA matching of all of them. So maximum HLA matching, minimum chances of rejection. We will select that. So such a graft is known as allograft, also known as homograft because the species is same. Here chances of rejection are always there. And this is the maximum category of transplant fall in this category. Maximum transplant fall in this category. Got it? And last, the worst type of graft. The worst type of graft is from different species. We don't perform it. We take the organ from the animals. In the previous era, we used to perform. We take the organ from the animals and implant it in the human. 100% rejection. High chances of rejection. Such a graft is known as Xenograft, also known as heterograft, because the species is different and there is high chance, very high chance of rejection. Got it? So out of all the transplants we perform, maximum will come in this category. Okay, so how many type of grafts are there? There are 4 types of graft. Can you enumerate? So if the donor is the self, it's autograft. If the donor is an identical twin, it's Xenograft or isograft. If the donor is any human being, it's allograft or homograft. If the donor is the animal, it's xenograft or heterograft. You get many MCQs from this. Please learn that. Now, the basic problem, 99% grafts fall in this category. 99% transplant fall in this category. So rejection is always the problem. Okay, so the same thing is written. You can see autograft, the donor is the self. Isograft or Xenograft, the donor is the identical twin. Allograft or homograft, it's the same species. And xenograft, it's from different species. The same thing is shown to you, the 4 types of the graft. So now let me tell you the types of the rejection. There are 3 types of rejection. Okay, so listen, whenever transplant surgery is performed, there are 2 teams of surgeons are required. One working on the donor and one working on the recipient. Preferably, we prefer to have the same hospital, same setting in which 2 OTs, 2 operation theaters are functional back to back, in which one donor team with the donor they are, and in other team there is a recipient a surgeon team which are working on the recipient. Okay, suppose you are a surgeon in the donor team, for example. So for example, there is a recipient. Let me draw a recipient here. The recipient is having bilateral renal failure and we have a donor available. Okay, here both the kidneys are failed. Okay, we have a donor available. You are a doctor, a surgeon who is working in the donor team, and I am working in recipient team, in recipient surgeon's team. So you have taken the kidney out of the donor, one of the kidney, and handed over to me. Now what is my responsibility? As soon as possible, you have handed over to me. Immediately I have to implant into the recipient immediately, because we cannot keep the graft out of the body for much longer. There will be autolysis, necrosis, autolysis, and the dead tissue will be there. We cannot keep that. If we are keeping, we have to keep it in the vital solution, but we prefer to implant it immediately. So as soon as possible, I receive the graft, the kidney. What I will do? I will take one of the kidney out, and in its place, I will put this kidney. So as soon as I have put the kidney, what I will do? First, I will cut. This was the old kidney. Okay. So this is attached with the renal artery and renal vein. So first I will cut renal artery and renal vein, take out the old kidney, put the donor's kidney here. Put the donor's kidney and attach it with the renal artery and renal vein. As soon as I have attached with renal artery, renal vein, I found the kidney got congested. It got failed. Before I suture and take the patient out, the kidney got congested. I got on the OT table itself. It's a flop show. It's a failed. It's rejected. On spot rejection. See, ma'am, it's as fast. Within few minutes, it's rejected. Before you have sutured, yes. Sometimes it is as fast as within minutes. And this type of rejection is known as hyperacute rejection. You can see, we are as soon as implanting the kidney and attaching with the renal artery and renal vein, it got congested, it got failed, it got rejected. It can be as fast as possible. So within few minutes it can occur. See, ma'am, how it is as fast as possible? It cannot be within few minutes. How it is possible, I mean? So this is the renal artery. As soon as you are connecting the donor's kidney with the renal artery, it is only possible in the scenario if the donor, if the recipient already have the preformed antibody for the donor tissue. These are known as preformed antibodies. The preformed antibodies are present in the recipient's blood. So you will see, ma'am, from where these preformed antibodies are coming in the recipient's blood for the donor tissue. This is the donor tissue. From where these? So if there is any sensitization, maybe the donor and the recipient are relative and the donor have given a blood in the past. Donor may have given the blood in the past and the recipient have bought the antibodies from that, and antibodies are present. Or maybe the donor have given some other graft in the past. Or maybe the donor is a child and the recipient is a mother. It is always possible. Now the child can give a graft to the mother. For example, there is a mother who is 60-year-old and she is having bilateral renal failure. Now the kid who is grown up, who is 30-year or 40-year, he wants to give one of the kidney to her mother, to his mother. So transplacental, when that kid was inside the uterus of the mother, at that time, due to reverse placenta blood flow, exposure can have occurred. And you know, body have a very strong memory in the immunity. So it can happen in that case. So the point is that hyperacute rejection occurs within minutes to hours, and it is due to preformed antibody. The first type of rejection is hyperacute rejection. How many of you got it? What is the source of these preformed antibody? Maybe the blood transfusion in the past between donor and recipient, maybe some organ, maybe the donor and recipient are mother and the child. So that can be the possibility. These are the three possibilities where the preformed antibodies are present in the recipient for the donor tissue. The second type of rejection is acute. It requires weeks to months to happen. And here both types of immunity are involved, humoral as well as cytotoxic. Okay, and the third type of rejection is the chronic rejection. It requires years to happen. And here delayed hypersensitivity will happen. So these are the three types of rejection: hyperacute, acute, and chronic. The three types of rejection. Got my point? The three types of rejection. The last thing, but not least, I want to add here. I want to add one more thing here. You may be thinking, ma'am, you told us the mechanism of hyperacute, but what is the mechanism of acute and chronic? You want to know? It's complicated. Shall I skip or shall I tell you? Huh? You want me to understand? You want me to explain the mechanism of acute and chronic also? Shall I? Okay, I will. If you are ready, I will. Definitely I will. So listen, there are two mechanisms, direct and indirect. Please understand how it's tricky. Now here two bodies are shown to you. Both of them are recipient. They are recipient. Please understand. This is recipient and this is recipient. They are recipient. And this is the donor tissue. This is the donor kidney or donor tissue which we have implanted in the body of the recipient. We have already implanted. We have implanted the donor tissue. The donor tissue contains the foreign antigens which are foreign for the recipient. These are the antigens. So what is the first step? The first step is the antigen presenting cell. The antigen presenting cell will come and engulf the foreign tissue, engulf the antigen, the foreign tissue, antigen presenting cell. Now the point is that whose antigen presenting cell? Sometimes the graft itself contains the antigen presenting cell of the donor only. The graft only contains the APC. This APC will engulf the foreign particle, the antigens which are present on the graft, and these APC, the APC of the donor. These are the APC of donor only. Okay, and after engulfing, they will present to the T lymphocytes of the recipient. So this is known as direct rejection. Direct. This is known as direct mechanism, and it is responsible for acute rejection. Acute rejection. Okay, on the contrary, see here. Here, the recipient's antigen presenting cell will get activated. They will come, they will engulf the antigen. The recipients, not the donors. Recipients APC will engulf the antigen. They will engulf and process it, degrade it, process it, and then present to the T lymphocyte of the recipient only. So recipients APC are only engulfing and presenting to the recipient's T lymphocyte. Here donors APC, after engulfing, they are presenting to the recipient's T lymphocyte. So this one is known as indirect mechanism. Indirect mechanism, and this one is responsible for chronic rejection. At least I tried. At least I tried. No one will try so hard, but at least I tried, so I'm satisfied. How many of you got it? Give me a thumbs up. The people who got it. If you got it, give me a thumbs up. People, say something now. Got it? Yes or no? Respond at least. I'm trying very hard to explain you. So these are the two types of mechanism, direct and indirect. So basic difference is that in direct pathway, it is the graft's ACP, the donor's APC, which are doing the processing. It is responsible for acute rejection. And in indirect pathway, it is the recipient's ACP who are engulfing, and it is responsible for chronic rejection. So I assume you know the mechanism of all three types of rejection. So how many types of rejection are there, people? You tell me how many types of rejection. Say, ma'am, there are three types of rejection. What are the three types of rejection? Can you enumerate, please? One is hyperacute rejection. One is hyperacute, second is acute, and third is chronic. Hyperacute rejection occur within few minutes on the OT table itself. I have given you an example before you suture the patient. Acute occurs within few weeks to months, and chronic occurs after years. Can you tell me the mechanism of the three? Hyperacute mechanism is very simple. It's preformed antibodies. So the recipient is having preformed, word is important here. It's preformed antibody for the donor tissue. From where the antibodies are coming, I have given you an example. For acute, the mechanism is direct pathway. In direct pathway, it's the donor APC who are doing the processing of the antigen. And this is responsible for acute rejection. And for chronic, it's indirect pathway. In indirect pathway, it's the recipient's APC who is doing the processing. So that is chronic rejection. So I tried. Got it? Can we go ahead? Can we go ahead? So this is the three types of rejection. Now the last thing here, so same thing is shown to you, direct and indirect pathway. The last thing is the graft versus host reaction. GVHD, graft versus host reaction, GVHD. Let me explain you. So what do you mean by that? So see here, everyone on the screen, everyone. So you can see this is recipient, this is recipient. Okay, again, these are the recipient. This is donor tissue, which contain the foreign particle. This is donor tissue. Okay, it is foreign for the recipient. So usually what happen? Say, ma'am, usually what happen? So the recipient body have the B and the T lymphocyte. These are the lymphocytes, B lymphocyte and T lymphocyte. Hana? They attack the donor and they kill the donor tissue. They reject the donor tissue. This is simply known as rejection. This is simple rejection. This mechanism is known as rejection. Rejection means who is rejecting whom? The recipient is known as host, by the way. Recipient and host is one and the same thing. Either you say recipient or you say host, one and the same thing. So basically the host is rejecting the graft. So if I say simple rejection, so I mean host is rejecting the graft. It's host versus graft rejection. This is known as host versus graft rejection. Give me a second. Give me a second. Okay, just a second. I will be back. Okay, so here you can see. So as soon as if I say the word rejection, here the recipient body contain the B and T lymphocyte, and these B and T lymphocyte are rejecting the graft. So who is rejecting the graft? The recipient. The recipient is the host. So host is rejecting the graft. Host versus graft rejection. Host versus graft reaction. It is simple rejection. If I say the word simple rejection, you have this imagination and you are right. Now sometimes reverse can happen. Now see what do you mean by reverse. Listen. Now there are two things to be happened. Number one, the graft is immunocompromised. The recipient is immunocompromised. The host or the recipient is immunocompromised. They don't have immune cell. Maybe the person is having HIV, maybe the person is on chemotherapy, maybe the person is on steroid. The person don't have much immune cell. You say, ma'am, it's a good thing. They will not reject the graft. I agree. They will not reject the graft. I agree. I totally agree. But here what happens? Sometimes, for example, this is a bone marrow graft. So the bone marrow graft contain the B and T lymphocytes, bone marrow graft. So the graft contain the immune cells. So rather host reject the graft is rejecting the host. Graft is rejecting the host. The graft, B and T lymphocyte find the host body as foreign and they start rejecting the host, various tissues of the host. So here graft is rejecting the host. This is known as graft versus host disease, GVRD, graft versus host reaction. Got my point? And this is known as runt disease, also known as runt disease, RUNT runt disease. I hope you got it. So this is graft. So rather than host reject the graft is rejecting the host. But here there are two prerequisites. What are the two prerequisites? Number one, the recipient should be immunocompromised. They don't have their own immune cell. And the graft must be immunocompetent. It contains the immune cell. People react. Got it? So the recipient don't have the immune cells. They are immunocompromised. And the graft have the immune cell. That is immunocompetent. Then only this combination is possible. Usually the reverse is there. Okay, got it. So this is the runt disease. This is known as runt disease. The graft is mounting an immune response on the host. This is known as runt disease. So the two prerequisites are the recipient is immunosuppressed. Recipient don't have immune cell. And the graft contain the immunocompetent T cell. So that is GVHD. Anyone have any doubt? Can we solve the PYQs, MCQs? We are done with this chapter also. 3 chapters are done till now in immunology. I will move on the 4th one after this. Can we go ahead? Yes. So listen, read the question, tell me the answer. The graft rejection due to preformed antibodies is known as what? Can you please answer, people? Quick, fast. Is it hyperacute rejection, acute rejection, subacute rejection, or chronic rejection? What is it known as? What is it known as? Yes. Yes, absolutely right. It's hyperacute rejection due to preformed antibodies. It is within few minutes. Okay. The next question, you can solve it. The next question, graft versus host reaction occurs only if. I told you the two prerequisite, no? I told you two prerequisite for GVHD, graft versus host disease. What is that? They're asking the condition for GVHD. Is it graft contain the immunocompetent B cell? No, it should be T cell. No, this is not correct. Graft contain the macrophages? No. Recipient must not reject the graft. Yes. Recipient must be immunosuppressed. Then only it's possible. Recipient is not on immunosuppressive drugs. No, it's wrong. So C is the correct answer. I hope you are getting it. I hope the question is very tricky. Yes, but you got it correct. Very correct. So can we move to the next topic? The next very important, the ultra important topic. Many students have demanded me this topic. That is autoimmunity. Till now, we have covered general immunology, hypersensitivity, and transplant. Let me come on the next one, that is autoimmunity. Let me start autoimmunity. What is autoimmunity? What is autoimmunity? So I told you autoimmunity. So we all have army. In the army, we have the soldiers. The soldiers are supposed to kill the terrorist. Okay, normally. Now imagine a soldier, instead of killing the terrorist, they are not killing the terrorist. They start killing country people, the own country people. So are they good terrorists? No, they are bad. Are they good soldier? No, they are not good soldier. They are bad soldier. They are killing own people. They are not killing the terrorist. This is autoimmunity. So in autoimmunity, who are the soldiers? In human body, who is the army? The army is the immunity. We can compare the army with the immunity. In the army, we have soldiers. In the immunity, we have two types of soldiers, B lymphocyte and T lymphocyte. Both are soldiers. They become mad. By mad, I mean they become self-reactive. What do you mean by the term self-reactive? They become self-reactive. They start killing country own people. They start killing own tissue. They don't kill foreign. This disease is known as autoimmunity. I hope you can understand it. So here the immune system becomes reactive for the self-antigen. For the self-antigen. The own immunity, the own soldiers start killing the own country. That is autoimmunity. That is autoimmunity. So normally so here also you can see the own immunity is killing, the own antibodies are killing the own tissue. That is autoimmunity. Okay. So normally, why not my B and T lymphocytes start killing my cell only? I'm having B lymphocyte in me. I'm having T lymphocyte in me. Okay, I'm having both the soldiers. We all have both the soldiers. Both the soldiers mean B and T lymphocyte. Why don't normally they kill the self-antigen? They don't have eyes. Oh, this is cell, this is foreign, I have to kill this, I don't have to kill this. How does they recognize? Why don't they kill self-antigen? They kill only foreign. Why? I'm asking because we all have a mechanism, inbuilt mechanism in us that is known as tolerance. Thankfully, God has given tolerance in all of us. We all have tolerance in us. Thankfully, that's why we don't have immune disease. Autoimmune disease, we don't have. So whenever there is a breach in tolerance, then the person have autoimmune disease. So you can't understand autoimmune disease unless until you don't understand tolerance. So first understand tolerance, because the definition of autoimmunity is breach in tolerance. Once the tolerance is breached, then only autoimmunity can occur. So what do you mean by the term tolerance? I'm having tolerance. You are having tolerance. Tolerance means we have resistance for the self-reactive B and T lymphocyte. Imagine in my body, some of the B lymphocyte or some of the T lymphocyte become self-reactive also. Still, the God has given us a protective mechanism that is known as tolerance. So let me tell you the tolerance, immunological tolerance. So for understanding the tolerance, there are two types of tolerance. Okay. For understanding the tolerance, there are two mechanisms of tolerance, central tolerance and peripheral tolerance, and it is having various mechanisms. I will discuss all of them, but let me explain you the term central and the peripheral tolerance. For this, you have to understand how does the B and T lymphocytes are formed. We have two soldiers, B and T lymphocytes. B lymphocyte and T lymphocyte are the two types of the soldiers. Where does they formed? They are formed in the bone marrow. And all the blood cells are formed in the bone marrow. Can you see a bone marrow? In the bone marrow, we have hematopoietic stem cell. From the hematopoietic stem cells, B lymphocytes are formed. From the hematopoietic stem cells, T lymphocytes are formed. Both of them are formed. So both of them are formed in the bone marrow only. After formation, they go for maturation. So B lymphocyte go to the bone marrow for maturation. So that's why it is known as B. B for bone marrow. That's why it is known as B lymphocyte. And T lymphocyte will go in the thymus. In the thymus for maturation. And that's why it is known as T. T for thymus. T for thymus. So have you ever thought in the English alphabet, we are having 26 letters from A to Z? Why we have selected only two, B and T? Not, we don't have P lymphocyte. My name is P. So it is not P lymphocyte. We don't have S lymphocyte. Why we have only B and T lymphocyte? Why not any other? Because B stands for bone marrow and T stands for thymus. That is the full form. B lymphocyte is bone marrow lymphocyte and T lymphocyte is thymus lymphocyte. So it is the organ of maturation. So B lymphocyte mature in bone marrow and T lymphocyte mature in thymus. And that's why they are named like that. How many of you got it? How many of you got it? Give me a thumbs up. So this is the basic you must understand. Okay, now we have two types of tolerance. So whatever soldier, imagine whenever there is a soldier, have you seen the soldiers of any country? Let's talk about India. In the Indian army, there are many soldiers. So first the soldiers training is done. for many months or years. They are trained. After that, they go to the war. They go to the field where they do the war or where they fight with the terrorists. Before that, the training is done. So in this way here, B and T lymphocytes are synthesized. They are matured. So their training is done now. Let's compare them with the soldiers only. So B and T lymphocytes are the two type of soldiers. So their training is done in the bone marrow and the thymus. This is the training camp. Imagine a soldier whose training is going on right now. The soldier is not in the war field. The training is going on right now. And during the training only, we found this soldier is not a good soldier. This soldier is going to kill the country people. So we will kill the soldier in the training only. We will not launch such a soldier in the war field because it's a mad soldier. It will kill the country people. We know that. So if we come to know that any B or T lymphocyte becomes self-reactive, if it becomes self-reactive, by self-reactive, I mean it become mad. It started killing this the own tissue. So we will kill such a soldier. If it is a B soldier, we will kill it in the bone marrow. And if it is a T soldier, we will kill it in the thymus. This is known as central tolerance. Central means they are killed in the central organ only. They are not launched in the periphery. Before that, they are killed. So God has given such a mechanism, such a beautiful mechanism God has given in all of our body, in me, in you. This is functional all the time. So this is known as central tolerance. So imagine in my body, any of my B lymphocyte or T lymphocyte become mad. It becomes self-reactive. It start killing the own tissue. So my body will kill it before they come in the blood. So if it is a B lymphocyte, it is killed in the bone marrow. If it is a T lymphocyte, it is killed in the thymus. Got it? So this is known as central tolerance. In the central organ, they are eliminated. They are removed before they come in the blood. People respond now. Got it? The central tolerance. You got it? But sometime in the training, imagine, again we compare the same soldiers with the B and T lymphocyte with the soldiers. So the soldiers training is going on. Imagine there is a camp where we are training the soldiers. We found some of the soldier is not a good soldier. He's having some foul intention. He's going to kill the country people. So before launching it to the field, we will kill that soldier. We will eliminate that. We will eliminate that soldier. You are getting my point, because it is self-reactive. It is self-reactive. But imagine by mistake, we couldn't identify it and such soldier is launched in the field. Such soldier, B lymphocyte or T lymphocyte, it is going in the peripheral blood. Can you see? This is the peripheral blood. Peripheral blood. Ultimately, after maturation, they go in the peripheral blood. But we didn't recognize they are self-reactive. They are mad. This one is self-reactive. This one is also self-reactive. What to do now? They have escaped the central organ elimination and they are mad. They are killing the country people. They are killing own tissue. No. We will kill it here. So killing them in the blood is also possible. That is known as peripheral tolerance. So that is a backup. God is great. God is always great. Whatever God has, constructed in our body, we are trying to decode that. We have decoded just 1%. 99% still a mystery. We don't understand many things yet. God is great. Okay, so God has given two mechanisms. What two mechanisms? We can kill the mad soldiers, the self-reactive lymphocytes at two places. Mostly, we will kill them in the central organ only. So B lymphocytes are killed in the bone marrow and T lymphocytes are killed in the thymus. So if they are killed in their central organ only, it is known as central tolerance. Tolerance is elimination of the self-reactive lymphocyte. And if they escape that and by mistake they are coming in the periphery, then there is a mechanism we can kill it in the periphery also. In the blood also we can kill it. And this is known as peripheral tolerance. Say yes, people. Got it? Can we go ahead? This is the two mechanism of the tolerance. So central tolerance, peripheral tolerance. One by one, we will see the mechanism. So let's talk about the central tolerance. What is central tolerance? Now you tell me, you understand. You understand. Okay. So central tolerance, we kill the self-reactive B and T lymphocyte. We are not killing normal healthy. Normal healthy are 99%. 99% soldiers are good. 1% are mad. Oh no. They are killing country people. So we have to kill these 1%. 99% are good. So in the same way here, the self-reactive, mind the word self-reactive, highlight the word self-reactive. By self-reactive, I means mad, the mad soldier, they are killing own people. So such B and T lymphocytes are killed in the central organ. So T are killed in the thymus and B are killed in the bone marrow. This is known as central tolerance. We got it. So apoptosis is done. B are killed in the bone marrow, I repeat, and T are killed in the thymus. In the organ, they mature. They are killed centrally only. And what is peripheral tolerance? Sometimes it's a backup mechanism. Sometimes the B and T lymphocyte who are self-reactive, they escape the central tolerance. So we have a backup mechanism. If they are not killed here, they escape and they are coming in the blood. No worries, we will kill them in the blood. So this is peripheral tolerance. For the peripheral tolerance, we have 5 mechanisms. You have to understand these 5 mechanisms. If you understand the 5 mechanisms, we will do the breach of the 5 mechanisms. First, I will explain you 5 mechanism. The breach in the 5 mechanism is the 5 mechanism of autoimmunity. People, I don't have to explain you the 5 mechanism of the autoimmunity. So if you understand the tolerance, the 5 mechanism of the tolerance, if the breach in them, if there is a breach in them, that will result in autoimmunity. So autoimmunity is nothing, it's a breach in tolerance. So you must understand tolerance. You people keep on focusing on the mechanism of autoimmunity, you don't understand tolerance. Bhai, jab tak tolerance nahi samjhoge, how you understand autoimmunity? Because autoimmunity is the breach in the tolerance. So pehle tolerance to samjho, fir you breach it, and that's autoimmunity. It's as simple as that. So let me explain you the 5 mechanism. You want me to explain the 5 mechanism? The 5 mechanism of the peripheral tolerance. Then we will breach them one by one. Okay, chalo. Got it? Chalo. So the 5 mechanism, let me read the names. The first is energy. See the spelling, it's energy. The second is phenotypic skewing. The third is apoptosis. Apoptosis. The fourth is regulatory T cells. The fifth is sequestration of the self-antigen. I will explain. The first one is the energy. Before explaining you the 5 mechanism, let's revise one of the type of immunity, cell-mediated immunity. There are 2 type of immunity now. What are the 2 type of immunity? My first slide today, before 2 hours or 1.5 hours, I started my first slide, the 2 type of immunity. Who will tell me? Who's attending the lecture from the very beginning? What are the 2 types of immunity, people? Humoral and cell-mediated. This is cell-mediated immunity, you can see. So we will revise it so that we will have a better understanding of the 5 mechanism of the tolerance. Okay, so what is happening here? See, antigen is coming. Who is antigen? Any terrorist, any foreign particle. So any foreign particle that is terrorist is entering in my body. It's entering in my body. As soon as it enters in my body, the first cell it interact is antigen presenting cell. Antigen presenting cell. Antigen presenting cell will engulf it, degrade it into multiple pieces, process it and present it on the surface. We know that. Till now you know that. Now it will go to T lymphocyte. It will go to T lymphocyte. Okay. CD4 T lymphocyte. See. So between APC and T lymphocyte, 2 type of signaling occur. Main stimulatory and co-stimulatory. So let me tell you what does it mean. So on the APC, this is the antigen. The antigen bind with the T cell receptor, TCR, T cell receptor. This is the main signaling. And what is the co-receptor signaling? So B7 present on the EPC bind with CD28 on the T lymphocyte. This is co-receptor. When both the signaling is completed, then cytokines are released and cytokine destroy the antigen. So please focus on the 2 type of signaling. I repeat, please focus on the 2 types of signaling, the main and the co. Main signaling and co-receptor, co-stimulatory signaling. So in main signaling, the antigen ka epitope bind with T cell receptor. And in co-stimulatory signaling, the B7 present on APC bind with CD28 of the T lymphocyte. When both the signalings are complete, then only cytokines will release. And this cytokine will kill the antigen. Say yes. So let me tell you what is energy now. Now you can understand what is energy. Now please see the 2 diagrams in front of you. See the difference. This is antigen and this is self-antigen. So if a foreign particle is entering, what will happen? And if a self-antigen, imagine, if a foreign particle is entering, okay, I want my system, immune system to get activated and kill it. But if it is my self-antigen, I do not want my immune system to kill my self-antigen. So see how God has given the protection. So if it is a foreign particle, see, this is a foreign particle, this is a self-antigen. See, both are stimulating the APC. APC will get stimulated. APC will give the signal to the T lymphocyte. So there is main signaling. There is no problem in the main signaling. Main signaling is all right, but co-stimulatory signaling is blocked. Normally B7 bind with CD28, then this co-receptor signaling happens. But here B7 is binding not with CD28. It is binding with CTLA4 receptor on the T lymphocyte. So co-receptor is blocked. Since the co-receptor is blocked, here cytokine release do not take place. Here it takes place. So here cytokine will kill the antigen. Here no cytokine, so the antigen is not killed. And this is how my self-antigen is not killed. Thankfully, God has given this mechanism to me, and this mechanism is known as energy. This mechanism is known as energy. How many of you got it? Or let me ask vice versa. How many of you didn't got it? There may be a people now who didn't got it. Energy. The mechanism is difficult, but I tried my best by these elaborative diagrams I have drawn. Beautiful diagrams, the line diagrams. Say yes, got it. So this is energy. So what is happening in energy? Unresponsiveness to the self-antigen. So whenever there is a self-antigen, so basically my body is not responding that. My B and T lymphocytes are not responding that. No cytokine release. So my self-antigen are not killed. So unresponsiveness to the self-antigen because there is a blockage, not in main receptor signaling. There is a blockage in the co-receptor signaling. The co-receptor signal is blocked. The co-receptor signal is blocked. Why it is blocked? Normally B7 bind with CD28, but here instead of CD28, it's CTLA4. Instead of CD28, there is CTLA4. So co-receptor is not there. So in the diagram also here you can see the main receptor is there. The main signaling is there. See, the main signaling is there, but co-receptor is not there. B7 is binding with CTLA4, so co-receptor is blocked. So there is no cytokine, and this is how the energy takes place. So this is energy. Second is phenotypic skewing. Now again see. If you got the first one, you will get the second. If you didn't got the first one, no way you are not going to get this. Now see, again compare. Here is the antigen, here is self-antigen. Compare and contrast. So here is a foreign antigen and here is a self-antigen. Huh? Both of them are stimulating APC. This is APC, this is APC. Got it? So here main signaling is okay. Co-receptor is also okay. So here main signaling, co-receptor. Here also main and co are okay. You see ma'am, both are okay. So it will get activated, yes, but here the cytokines are reactive. Here the cytokines are non-reactive. So it's okay, even if main receptor and co-receptor both are okay. Both are done, but cytokines are non-reactive. So God has protected us at this step. God has not protected us at this step, but God has protected us at this step at least. So the cytokines are non-reactive. So here the cytokines will kill the antigen. But since these cytokines are non-reactive, they will not kill the antigen. So this mechanism is known as phenotypic skewing. This mechanism is known as phenotypic skewing. You got it? Anyone? Huh? Jaswini, Dr. Shweta, Rifat, huh? Tawfiq, Loyan. So you all got it, no? So you got the difference between the energy and the phenotypic skewing. The step is different. The step is different. In energy, this step was blocked. The co-receptor signaling was blocked. That's why cytokines were not releasing at all. Here, this step is not blocked. Here, cytokines are releasing, but they are non-pathogenic. They are non-reactive. This step is blocked. So ultimately, the self-antigen is not destroyed. That is the point. Got my point? The third mechanism is apoptosis. Apoptosis by activation-induced cell death. Activation-induced cell death. So here, now see the last one. See. So here also we have one antigen, one self-antigen. See, this is antigen. This is self-antigen. Okay. Both of them are activating APC. Okay. Here also main receptor and co-receptor is done. Here also main receptor and co-receptor is done. Here also cytokines are released. Reactive. Here also cytokines are released reactive. Say, ma'am, they are reactive. So they will destroy the self-antigen. No. Before this destroy the self-antigen, this is destroyed by apoptosis. If you know there is a signaling of apoptosis, the death receptor, fast receptor get activated and it will do the apoptosis of such cell. So such cell undergo apoptosis and the self-antigen is not destroyed. So at 3 different steps we are protecting. This is known as apoptosis by activation-induced cell death. So either we are blocking the co-receptor signaling. Okay. See, if we are blocking the co-receptor signaling, it is known as energy. If we are blocking the cytokine release, I mean the non-pathogenic cytokine, it is known as phenotypic skewing. And if we are doing the apoptosis of such a T cell, it is known as apoptosis of AICD. Anyone who didn't got it? Say yes, say no, say something. Okay, I'm teaching you the mechanism of autoimmunity. DAC night. Okay, so the next is the regulatory T cell. How many type of T lymphocytes are there? So T lymphocytes are cytotoxic T lymphocytes. We have CD8. We have CD4 lymphocytes. Okay, and the third cell, we are having a regulatory T lymphocytes. A set of lymphocytes is known as regulatory God has given. What is the function of the regulatory? Imagine there are soldiers. I told you these all are soldiers. We have to kill such a soldier which become mad. Such a soldier which start killing the own country people. We have to kill that soldier. So these are the super soldiers. They are above soldiers. What is their role and responsibility? The regulatory T cells, these are the soldiers. Their responsibility to watch all other soldiers. If any soldier become mad, start killing the country people, we have to kill. I mean this regulatory T cell have to kill that soldier. So it will down regulate or kill the self-reactive T lymphocyte. So these are the super soldiers. That keep a watch on the soldiers, normal soldiers. If any one of them becomes self-reactive, these soldiers, the super soldiers, kill them. So that is regulatory T cell God has given us. And the last one is the sequestration of the self-antigen. The last mechanism is the sequestration of the self-antigen. What do you mean by sequestration? Sequestration is the alternate word for hidden. These are the hidden antigens. What do you mean by that? Achha. I told you in our blood, we have 2 types of soldiers God has given. the B lymphocytes and the T lymphocytes. So these are B lymphocytes we are having, and these are T lymphocytes they are having. I call them soldiers because they kill the foreign. They do not kill the self. Once they start killing the self, they are killed. Okay, so they kill the foreign. How did they kill the foreign? Do they have the eyes? They keep on seeing, this is self, this is foreign, I have to kill this, I do not have to kill this. It's like that. No. Then how they recognize self? How the B and T lymphocyte recognize and differentiate, is it self or is it foreign? I'm asking you. So there is a theory behind that. The theory is known as Bunnet theory. What is the Bunnet theory? So whenever we all are fetus or embryo or fetus inside the uterus of the mother, imagine this is a fetus inside the uterus of the mother, and this is the placenta connecting the mother and the fetus, and this is the blood flow in the fetus. So in the blood flow of the fetus, these are the B and T lymphocytes which are there in the fetus. Okay, so during the fetal life, these B and T lymphocyte come in contact with various tissue, various organs of the fetus. These are the various tissue. So they will recognize itself. They will, because the fetus is not yet out now. It is not in the outer world. So whatever is their body, it is self. So fetus, the B and T lymphocyte will recognize itself. Now after coming out, anything apart from these is considered as foreign. So they took a memory that this is all self. This is all self. Ab isko chhod ke jo bhi bacha, whatever remaining after this is foreign. You are getting my point. So self is all the tissue. Self is all the tissue which is coming in contact with the blood during fetal life, during embryonic life, during fetal life. So all the tissue which come in contact with blood of the fetus is the self, because the B and T lymphocyte during fetal life will recognize them as self. But there are certain tissue which are avascular in our body. For example, the lens of the eye. They don't have blood vessel. The cornea of the eye, they don't have the blood vessel. So they are my self antigen. But my B and T lymphocyte have never experienced them, have never exposed them. So my corneal cells, my lens cell, they are foreign for my own body. They are hidden. They are my self, but my for B and T lymphocyte have never recognized them. No? If now, for example, I have keratitis or I have any disease in the eye of the lens, and the protein of my lens or the protein or tissue from my cornea leak and go in my blood. Imagine, it can happen in the ophthalmology, you read many diseases. So the lens protein or the corneal tissue dissolve and leak and go in the blood. So my B and T lymphocyte will attack or do not attack. They will attack or do not attack such antigen. They will attack because they will recognize it foreign. They will recognize it foreign. You are getting my point, because they have never seen them. So this is known as, this is the meaning of the sequestration. Sequestration means hidden. In the same way, the sperms of the male. So what is the male genital tract? In the male genital tract, we have, the males have the two testes. From the testes, this is the epididymis, which is coming out. Epididymis leads to vas deferens. So this is epididymis. This is vas deferens, and it open in the urethra. So this is the urethra. So trying to draw the urethra here. It is opening in the urethra. Okay. This is the urethra. You can see we are drawing. So this is the thing. So here the sperms are synthesized in the testes. The sperms will go in the epididymis. They will go in the vas deferens, and they will go in the urethra and out of the body. So sperms do not come in contact with the blood. Sperms do not come in the contact in the blood in a male reproductive system, male genital tract. Now what about the vasectomy? What is the surgery vasectomy? The vas deferens is cut and sealed. It is tightened with a thread. It is sealed. Cut. The two ends are cut and they are sealed. So here the sperms are synthesizing in the testes. Sperm synthesis do not stop. So sperms are synthesizing, but the pathway is blocked. So there is regurgitation of the sperms. They will go back. They will go back and they will leak in the blood. The sperms will come in the blood. Once the sperm will come in the blood, they are recognized as foreign and they are destroyed by the antibodies. Anti-sperm antibodies are formed. So although they are the self tissue, but the immunity will destroy them. So again, an example of the sequestrated antigen. Got my point? Got my point? Say yes, say no, say something. Got it? Can we go ahead? Can we go ahead? So this is, what are the 5 mechanisms of tolerance? There are 2 types of tolerance. You understood what is tolerance? Tolerance is a mechanism by which we can protect our human body, our own body, from the self-reactive soldiers, self-reactive B and T lymphocyte. God has given 2 types of tolerance, the central tolerance and the peripheral tolerance. Central tolerance and peripheral tolerance. In central tolerance, the B and T lymphocytes are killed when they become self-reactive. The self-reactive B and T lymphocytes are killed in the central organ. That is, B lymphocytes are killed in the bone marrow and T lymphocytes are killed in the thymus. That is central tolerance. Sometimes they escape and they come in the peripheral blood. So in the peripheral tolerance, they are killed in the blood, the peripheral blood. There are 5 mechanisms of the peripheral tolerance. What are those? 1, 2, 3, 4, 5. What are the 5 mechanisms? Energy, phenotypic skewing, apoptosis by AICD, regulatory T cells, and sequestration. Now, if there is breach in any of them, that is autoimmunity. So what is autoimmunity? Let's start the topic autoimmunity. Okay, now you are ready to understand autoimmunity. Autoimmunity is nothing. It is the breakdown of tolerance. If the tolerance got breakdown, there is autoimmunity. So either breakdown of energy, breakdown of AICD, loss of regulatory T cell, release of the sequestered antigen, or molecular mimicry. These are the 5 mechanisms. Breakdown of energy, you got it. Normally, energy may there is unresponsiveness to the self antigen because of blockage of the co-stimulatory signaling. Imagine a person in which this signaling is not blocked, and the self-reactive antigen also activating the T lymphocyte. So the person will have autoimmunity. Example in multiple sclerosis, rheumatoid arthritis, psoriasis. The second is failure of AICD. I told you, whenever the T lymphocyte becomes self-reactive, there is apoptosis of such a T lymphocyte. Whenever soldier become mad, start killing the country people, we kill that soldier. But here, we are not killing that soldier. That soldier is not apoptosis, and that soldier keep killing the country people. So the person can have autoimmune disease, that is SLD. Okay, that is failure of AICD. Sometimes we have super soldiers. Now in our body, I am having super soldiers. What is the responsibility of those super soldiers? They keep an eye on the soldiers. If any soldier become mad, they kill that soldier. But imagine I'm not having super soldier in my body. So who will kill the mad soldiers? So that can be the mechanism. Or the release of the sequestered antigen. As I told you, the corneal protein, the lens protein leak and come in the blood. So they are foreign. Or in vasectomy, the sperms are going back in the blood. So again, so these are the examples. The spermatozoa release after vasectomy, after uveitis in the eye, the ocular antigen, the lens and the corneal tissue, they will leak in the blood. So this is an example. And last one is molecular mimicry. The last one is the molecular mimicry. What do you mean by molecular mimicry? So imagine a virus or a bacteria, or let's say an organism, better, an organism enter in my body. This organism is having certain antigens. Okay, it is foreign for me. It is foreign for my body. My body is making antibodies for that. My antibodies are made, and antibodies will react and kill that antigen. You will say, it's a very good thing, ma'am. But the problem is that, what's the problem? There is a problem. The problem is that this is my own tissue. This is my self tissue. This is my own tissue or self tissue. On my self tissue, I am having same antigen as that of organism. See, the antigens are same, relatively same. So antibodies are formed. These are the antibodies. They are formed for this, but they will get confused. The antibody thing, it is also organism, and my antibodies will come and start killing my own tissue. This is known as molecular mimicry. Who's doing mimicry? What do you mean by the word mimicry? Mimicry means nakal karna, to copy someone. Mimicry means to copy someone. We are copying someone, we are doing the mimicry of someone. So here the organism is doing the mimicry of the self tissue. They are having the same antigen. So whatever antigen is present on the organism, the same antigens are present on the tissue. So actually the antibodies are formed against the organism, but the antibodies are killing the tissue also. This is known as molecular mimicry. So molecular mimicry can also lead to autoimmunity. People say, yes, got it. So this is the molecular mimicry. Okay, what are the examples of molecular mimicry? For example, we all have HLA-B27. So the Shigella, if Shigella enters, so Shigella also have the same antigen as that of HLA-B27. So antibodies are formed for Shigella, but antibodies start killing the HLA-B27 cell also. So that can be the molecular mimicry. In the same way, whatever antigen present on the joint, the same antigen present on the Mycobacterium tuberculosis also. Whatever antigen present on the heart, the same antigen presents on the Coxsackie B virus also. Whatever antigen presents on human 5 organ, including heart, the same antigen is present on the streptococcus also. So these are the examples of molecular mimicry. Okay, we are done with autoimmunity. How many of you are ready? How many of you got it? How many are completely satisfied with the topic autoimmunity? Say yes. How many of you got it? Say yes, say no, respond, say something but. Everyone got it? Shweta, Dr. Shweta, regulatory T cells are the super antigen. We have soldiers. These are the super soldiers. We have soldiers. What is the job of the soldiers? Soldiers are supposed to kill the foreign. They are not supposed to kill the country people. They are supposed to kill the terrorist. Who will mind their job? So we have super soldier post. We have a post in the army which is known as super soldier. What does these super soldier do? They keep an eye on the soldier. If any soldier become mad, immediately they kill that soldier. In the same way, in the body, we have regulatory T cell. Any T cell become mad, these will kill that. Dr. Shweta, got it? Anyone have any confusion? So ready for the questions? Read the question and tell me the answer. Read the question and tell me the answer. Say. So the question is, all are the examples of molecular mimicry except. I've given you 5 examples of molecular mimicry now. So Shigella and HLA-B27 is an example. I'm asking except. Have you missed the word except? Huh, Ahmed? So I'm asking except. So this was the example. Mycobacterium tuberculosis and joint membrane was also there. Coxsackie B virus and heart was also there. But Salmonella typhi and HLA-DRQ is not there. So incorrect among them is D. So you have to learn these examples. Okay, these examples are important. Lens protein is an example of I-lens protein. It is an example of cross-reacting foreign antigen, sequestered antigen, molecular mimicry, or forbidden clue. So what is an example of lens protein? Imagine if my lens protein leak and go in the blood, my blood will reject, blood will destroy it. My B and T lymphocytes will destroy it. Why? What is the mechanism? Yes, it is the sequestered antigen, the hidden antigen. We are done with this chapter. Got it? You want me to take one more? You want me to take one more? Yes. So immunodeficiency disorder. Can we go ahead? So let's go ahead. The immunodeficiency disorder, the last chapter I am taking. Okay. So in immunodeficiency disorder, now what do you mean by immunodeficiency? As the name indicate, here we have deficiency of soldiers. Deficiency, immunodeficiency. So here soldiers are less. We have less soldiers. So either B lymphocytes are less, or T lymphocytes are less, or both are less. Both are less. So we have 3 types of immunodeficiency. We have deficiency of the immunity. It's not exaggerated. In hypersensitivity, it was exaggerated. Here we have deficient. Here we have deficient, immunodeficiency. So the defense mechanism is impaired. It's deficient. So we have 3 types of immunodeficiency. If B lymphocytes are deficient, is known as humoral immunodeficiency. If T lymphocytes are deficient, it's known as cellular immunodeficiency. If both of them are deficient, B and T, it is known as combined immunodeficiency. How many of you got it? Okay, got it. So you have to learn the examples. Then one prototype disease I will explain in detail, but you have to learn the examples. So in humoral, so we have 3 types of immunodeficiency. B lymphocytes deficient, it's known as humoral immunodeficiency. T lymphocytes are deficient, it is known as cell-mediated immunodeficiency. Cell-mediated immunodeficiency. If both of them are deficient, B and T both are deficient, it is known as combined immunodeficiency. Okay. So in humoral immunodeficiency, the mnemonic is big camera. Camera ko we call cam na. BCAM. The mnemonic is BCAM. B stand for Bruton disease. C stand for common variable immunodeficiency. A is IgA, isolated IgA deficiency. And M is IgM, hyper IgM syndrome. So say BCAM. BCAM. So say the full form. Bruton, common variable immunodeficiency, isolated IgA deficiency, hyper IgM syndrome. So learn that. Now the T cell deficiency. The T cell, cellular mediated immunodeficiency. The mnemonic is DCP. There is a post in the police now, Deputy Commissioner Police. So DCP. D stand for DiGeorge syndrome. C stand for chronic mucocutaneous candidiasis. And P stand for PNP. That is purine nucleoside phosphorylase deficiency. Many MCQs even come on the simple classification. And the last one, combined, where B and T both are deficient. Combined. So the mnemonic is SWAN. 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 S stand for severe combined immunodeficiency, SCID. W stand for Witkoff-Eldridge syndrome. A stand for ataxia telangiectasia, and N stand for Nesloff syndrome. So first of all, you have to learn the classification of immunodeficiency disorder. How many types of immunodeficiency disorder? B lymphocytes are absent, that is humoral immunodeficiency. T are absent, that is cell-mediated immunodeficiency. And B and T both are absent, that is combined. So say the mnemonic. Here the mnemonic is big CAM. Here the mnemonic is DCP, and here the mnemonic is SWAN. The first thing you have to learn the classification. If you don't like this mnemonic, learn some other mnemonic, but please learn that. So here Bruton, common variable immunodeficiency, isolated IgA deficiency, hyper IgA syndrome, IgM syndrome. Here D for DiGeorge syndrome, C for chronic mucocutaneous candidiasis, P for PNP. Here S for SCID, severe combined immunodeficiency, W for Witkoff-Eldridge syndrome, A for ataxia telangiectasia, and N for Nesloff syndrome. Now I will teach you one prototype disease of all 3. That's it. Okay, one prototype disease of all 3. So here the most important is Bruton. Here the most important is DiGeorge, and here most important is SCID. So let's start it. One disease. That's all about it. So let's start with the Bruton disease, the prototype disease of humoral immunodeficiency. So you know how does the lymphocytes are formed? It's a deficiency of the B lymphocyte. How does B lymphocytes are formed? See, ma'am, they are formed in the bone marrow. How? So they are formed from the hematopoietic stem cell. From the hematopoietic stem cell, pro-B cell are formed. Pro-B cell convert into pre-B cell. Pre-B cell convert into immature B cell. Immature B cell convert into mature B cell. For maturation, they will go in the bone marrow. They remain in the bone marrow mature. Mature B cell convert into the plasma cell, and plasma cell form the antibody. So this is the sequence. So from the hematopoietic stem cell, pro-B cell are formed. From the pro-B cell, pre-B cell are formed. From the pre-B cell, immature B cell are formed. From the immature B cell, mature B cell are formed. The mature B cell. And from the mature B cell, plasma cells are formed. And plasma cell leads to formation of the 5 type of antibodies. Say yes or no. For the conversion of pro-B to pre-B, we require an enzyme. The name of the enzyme is Bruton tyrosine kinase, BTK. Bruton tyrosine kinase, BTK. Imagine if this enzyme is absent in someone. So pro-B cell will not convert into pre-B cell. No pre-B cell, no immature, no mature B cell, no plasma cell, no antibody, zero antibody. Since it is zero antibody, the other name is A-gamma globulinemia. Gamma globulin means antibody. A matlab absent. Absent antibodies. A-gamma globulinemia. Got it? So that is Bruton disease. It is seen in males because it is autosomal recessive. It is autosomal recessive. That's why it is seen in males. The inheritance is autosomal. We know in autosomal recessive, the females are carrier and males are the cases. That's why it is seen only in males. Here the enzyme BTK is absent. No BTK, pre-B cell are not formed, immature are not formed, mature are not formed, plasma cells are not formed, antibody are not formed. Zero antibody. So no B cells are formed. Person is highly susceptible for all bacterial infection. Virus and parasitic also, but mainly bacterial infection. Got it? We are done with Bruton. Now we will see DiGeorge. In Bruton, B cells are absent. In DiGeorge, T cells are absent. How? What is the mechanism? What is the mechanism? So how many chromosomes humans have? Humans have 46 chromosomes. How many chromosomes? 46. Instead of saying 46, say 23 pairs. So this is pair number 1, pair number 2, pair number 3, pair number... Likewise, total 23 pairs. I'm interested in pair number 22. On the pair number 22, there is a chromosome. Pair number 22, there is a gene on this chromosome. On the Q arm, gene number 11. So on the chromosome number 22, on the Q arm, we know there are two arms, P and Q. So chromosome number 22, on the Q arm, the 11th gene got deleted. So this gene got deleted. So say which gene? 22q11. Say the number 22q11 gene is deleted. So what it is required for? It is required for the synthesis of third and fourth pharyngeal pouch. You know, pharyngeal pouches are formed during embryology. So third and fourth pharyngeal pouches not formed. What structures are formed from third and fourth pharyngeal pouch? Have you read embryology in anatomy? So there are 4 structures are formed. Thymus, parathyroid gland, a portion of the face, and aortic arch. Heart, aortic arch. So all these are not formed. But since third and fourth pharyngeal pouch are not formed, so no thymus, no parathyroid gland, no face, a portion of face is, malformed, and aortic arch. So these 4 things are not formed. Since thymus is not formed, thymus is required for maturation of T lymphocyte. T lymphocyte will be absent. Since T lymphocyte is absent, it's DiGeorge syndrome. So in DiGeorge syndrome, what is the problem? What was the problem in Bruton? In Bruton, the problem was BTK was absent in the bone marrow. No BTK, so pro-B cell cannot convert into pre-B cell. Pre-B cell is not formed, immature is not formed, mature is not formed, plasma is not formed, plasma cells and immunoglobulins are not formed. So here B lymphocytes are absent. Here the gene on chromosome number 22q11 is absent. So third and fourth pharyngeal pouches are not formed. So thymus is not formed. So T lymphocyte will not mature and T lymphocyte will be absent. That is DiGeorge. Got it? Coming on the last one, SCID. We are done with Bruton. That is an example of humoral immunodeficiency. We are done with DiGeorge. That is an example of cellular immunodeficiency. And now I'm coming on SCID. Severe combined immunodeficiency. What will happen here? Here both humoral and cell-mediated immunity are absent. Both of them are absent. So B and T both are absent. Both lymphocytes are absent. Both type of soldiers are absent. So it is having 2 presentation. One is X-linked and one is autosomal recessive. Autosomal recessive one is more common. It is more common. Let me explain you that. So we have purines and pyrimidines in the cell. In the cell, we have purine and pyrimidine in the nucleus. So purines and pyrimidines are there. So how does the purines get deactivated? What is the metabolism of purine? Adenosine is a purine. Adenosine, thymidine, guanine, cytosine. We are having these nucleosides. So how does adenosine get metabolized? Normally, adenosine convert into inosine. Adenosine convert into inosine. If you have read this in biochemistry, you may be knowing that. Inosine. Normally, it requires an enzyme. The name of the enzyme is adenosine deaminase. adenosine deaminase enzyme, ADA, is required because adenosine is toxic. It convert into a non-toxic thing, that is inosine, and get metabolized. Okay, but imagine if this enzyme is mutated or absent. God has not given this enzyme, so adenosine will not convert into inosine. Adenosine will remain as adenosine only, but it's toxic. It's toxic for B and T both lymphocyte. It will kill B as well as T, so that's why both are absent. So here the main problem is that ADA is absent. ADA is absent, so adenosine will not convert into inosine. So here the ADA, adenosine deaminase enzyme, is mutated, which is required for purine degradation. So ADA is absent, so there is accumulation of adenosine. It will not convert into inosine, and it is toxic for B and T both, and that will lead to severe combined immunodeficiency. People respond. Got it? Got it. So we are done. So I taught you 3 types of immunodeficiency: humoral immunodeficiency, cell-mediated immunodeficiency, and combined immunodeficiency. Here B cell are absent. Here T lymphocytes are absent. Here both are absent. Here I have given you 4 example big cam. Here I have given you 3 example DCP. And here I have given you 4 examples SWAN. You have to learn all the examples, but learn the mechanism of main one. Here I taught you Bruton. Here I taught you DiGeorge. Here I taught you SCID. So what is the main mechanism in them? In Bruton, the enzyme BTK is absent. No BTK, pro B cell cannot convert into pre B cell. No B cell is formed. No immature, no mature, no plasma cell, no immunoglobulin. So B cells are absent. Here the problem is that chromosome number 22q11 gene is missing. It's absent. It's deleted. And that's why the 3rd and the 4th pharyngeal pouches are not formed. So thymus is not formed. So T lymphocytes are absent. Here the problem is that adenosine deaminase enzyme is mutated. So adenosine will not be degraded. It will remain as adenosine only. It will not convert into inosine. So adenosine is toxic for B and T lymphocyte, and it will kill both of them. I tried. At least I tried from the depth of my heart with my full energy, full attention. So you got it, huh? You got it. So MCQs I'm skipping, you can do by your own. They are very easy. So we have covered many topics except amyloidosis, but it's got late. I assumed that in 2 hours I cover amyloidosis also, but it will take additional 20 minutes. So I will schedule another session for the amyloidosis. Don't worry, in detail I will schedule another session with many more topics. So if you have any other topic in your mind, kindly let me know. So immunology is completed. So give me a second. Let me tell you what I have decided for you people. Let me tell you. Just a second. Then you people can go. Give me a second. Let me tell you my next session. Okay. So thank you so much. If you have any query, you can ask your query on this number. You can note down the number. It's 9321 001103. So please note down the number, take a snapshot, save it, and if you have any query, please WhatsApp your query, text your query, don't call. Text your query. I will leave a voice message. Whatever is your query. If you have any topic in your mind in patho, pharma, micro, medicine, PSM, kindly text that topic also. I will try to schedule it as soon as possible on the YouTube. If many students are demanding the same topic, kindly text it on this number. Okay, so the team will do the workup, and if many students are demanding the same topic, soon we will do so. So if you want the notes of this session, which I have taken right now, immunology, or all other sessions which I have taken on the YouTube, all the notes are available free. You can click on the link given in the iCard. The link will be provided after the session on the iCard. You can click, or it will be given in the comment box also. Okay, and here is a QR code. You can scan it. By scanning it, you will be diverted towards the website, that is MedLife by Dr. Priyanka, where you can connect with me on various social media platforms, that is Instagram, WhatsApp group, Telegram channel. You can connect with me where I share educational content for the medical entrance exam, the top-notch educational content. So kindly connect with me and you can follow me if you wish. Thank you for your time and attention. So this was just a trailer. If you want the complete course of pathology, it's already available on the app at a very nominal price. The link of the app is given in the card. You can click on that. And there are many free videos. Even if you don't want to purchase, it's okay. But there are many, more than 20 videos are free. Just watch that. You will get the idea of the quality and the content. So just watch. There are many important topics, which are most important topics, which are asked in your exam. They are available free. So you can just watch that. So click on the link and you can visit our app also. Thank you so much. And the next session is planned on Sunday, on 12th of May. That is Sunday, this Sunday. Okay, 12 noon onwards. Okay, and the topic I decided, TB, everything about TB. starting from the pathology, microbiology, and pharmacology portion. I will teach you everything: the primary TB, secondary TB, its treatment, DOTS plus, MDR-TB, XDR-TB, causative organism, granuloma formation, each and everything of TB. The 5 first-line drugs, HRZES. We will dissect TB, everything about tuberculosis, each and everything. So it will be an integrated session. It is not from only pathology. It will be patho, micro, pharma, medicine, everything. So that is the next session. Thank you so much. Thank you so much for being with me. And soon I will schedule all these topics which you are requesting in the comment box. So definitely after ending the session, I will scroll the comment box and note down the topics, and you can text the topics on that number also. Thank you so much. So just a second. Thank you so much. And thank you for giving your precious time to me. Good night. Bye-bye. I'm ending the session. Wishing you all the best. Whatever exam you're targeting for, give your best shot. Okay. Bye-bye. I'm ending.